Hello, 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 my dear friends. How are you all? Very good evening to all of you. So, जिंदगी कैसी चल रही है? How is the life going on? So, I'm very sure that you all must be busy with your studies, focusing on your goal and preparing very hard for your upcoming examination. So, I could see that many friends are here. So, I could not take the name of everyone, but very good evening to all of you. So, as we had reached to that point that we are just 3 days away from our Neet PG 2022 exam and 17 days away from our FMGE June 2022 exam. So, I think the two questions must be rolling in your mind. The question number one is that whatever the content I am having, is this enough to crack the exam? Is this enough to have the good score or the good rank in the upcoming exam? And the second is, what will be my result? What will be my outcome? What will be my fate? So these are the two very, very important questions which must be coming in your mind. And it must be irritating you every time, every day. So mind my words, my dear friends, that you had so much of content that you are not even able to crack this Neet PG or the FMG exam. You can crack any one of the exam related to the medical science of the world also. You are having so much of the content. But the problem is that how to utilize that content. So now, as we know that successful people are not those people who had done something different, but they are doing in a different way. So, the successful students in the exam are not those who had studied something different, but they are applying this concept, applying this knowledge in a different way in the exam. Because as we know that you are having so much of content of not only of a one subject. Suppose today we are here to discuss the important clinical questions of community medicine, but you are having the content of the total 19 subjects of the medical curriculum. And you have to carry this weight, tons of weight, to your examination hall. Now, those students who smartly carry this knowledge to the examination room, and what we mean by smartly, that they are able to recollect, they are able to apply that knowledge, and they are able to exclude out the various options, coming to the correct answer in a given time frame. That is again very, very important. So those who are smartly managing all these points, they are the winners of the exam. So I'm not saying that you have to work smartly in the way that you are going to do the cheating in the examination hall, or you are wasting your time to preparing the notes just to keep in your pocket everywhere. No, you have to learn the technique, or you have to learn the trick and the technique that how to act smartly in the upcoming examination, because in the end, nobody cares about your efforts. Only the result matters. And if you had seen the story, or if you have read the story, if you have discussed with your seniors, you had come to know that some of your seniors say, भाई मैंने तो खाली 2 घंटे पढ़ा था, लास्ट में 2 घंटे पढ़ा, 2 घंटे रोज का पढ़ता था, लास्ट में 1 महीना 2 महीना पढ़ा एंड मैं पास हो गया. Some of your seniors might be saying that I was studying only the 2 or 3 hours per day. I studied only for the 1 month, 2 months in the last. And yes, he or she had scored quite well and passed the exam. And might be some of your seniors, they say that I was studying 10 hours, 12 hours, and I was studying for the past 6 months, 1 year, but still was not able to crack. So, we have to learn that how to apply this knowledge smartly in the upcoming examination. Means at this moment, we should be knowing what to study, what not to study, and how to answer our questions. Okay, so we will be discussing all these tips and the tricks that how to act smartly in the upcoming examination to get the best possible result. Okay, now as we know that you all are in stress, obviously we are the human beings, we are in this stress. So we have to handle this stress, because if we cannot handle the stress, we cannot manage the success. So after a few days, we have to manage the success also. So we are trying to handle the stress at this moment so we can cheer the success, we can handle the success in the upcoming time. Now, as we know that success is not being given to you in a tray. कोई ट्रे में ला के आपको सर्व नहीं करता कि ये आपकी सक्सेस है, आपका ये पासिंग सर्टिफिकेट है. नो, you have to do this struggle. You have to fight for your success. So, as I can presume that each one of you are away from your comfort zone and you are struggling very hard. Some of you might be staying in the hostel, might be having such bad weather, no cooler, no AC, only the fan is there, or might be struggling with your food, away from the home food, might be feeling the homesickness, but still, I know that you are the brave people. You can manage this situation and you will come out with the flying colors. As it has been very rightly said, that you might be having so many factors which can distract you. But if you are having the one firm determination that I have to win this race or I have to achieve this goal, then those distracting factors cannot affect your ultimate goal. And our ultimate goal, हमारी मंजिल क्या है? एग्जाम में क्लियर करना. If it is FMGE exam, we have to pass this exam. If it's a Neet PG exam, we have to achieve a good score so we can get a rank and we can get a seat of our desired subject. So, if you had focused yourself towards your manjil, towards your goal, then no distracting factors can affect you. And ultimately, you're going to win in your journey. So, my dear friends, the struggle what you are doing today is giving you the strength, and this strength is very, very important in your upcoming examination day. And what struggle you are doing, you are studying, you are giving your subject test, you are giving your grand test, you are analyzing your mistakes, and you are learning from your mistakes, understanding your mistakes, and promising you that you are not going to repeat those mistakes. And this is what is your increasing your strength in the upcoming examination, and that will be very helpful for your on the day of examination or for clearing your exam or getting the good marks. Okay, so friends, let's start our journey of 25 most important clinical questions related to community medicine. So we will be focusing on the concept of those questions because, my dear friends, it is seen that questions are not exactly the copy-paste questions. They're not being repeated, but yes, the concept is being repeated. So if we are very well aware of that concept, we know the concept very clearly, so we can answer the question left and right, up and down related to that area. So we will be trying to understand the concept of these most important 25 clinical questions, which we, as per our clinical experience, can imagine that these are the high yield areas from where repeatedly questions are asked in your upcoming examination. Okay, so friends, let's start with this question. Now suppose if I'm reading a question from the top, so I read that in a month of March, a young gynecologist from the Rajasthan committed suicide. So now this is the one keyword coming as suicide. So my mind starts thinking that this question may be related to the forensic medicine. And I'm thinking about the suicide, the causes of the suicide, the diagnosis. Now, if I read further, that following the suicide, following the police case filed against her after the death of a patient. So now I'll be starting thinking of the various IPCs and what can be in the suicide and all. If I read further that in a patient due to the PPH, my mind immediately diverts to the PPH. I might be thinking, oh, this could be a question of the gynae. What are the various causes of the PPH? And what are the prevention of the PPH? What drug I should give? So you start thinking of the PPH. Now, to avoid such future accidents, the government made mandatory prophylaxis use of oxytocin and methadone after each delivery to avoid the PPH. Now, you might be thinking that they are asking about the mechanism of action of this drug, oxytocin, methadone. It could be a pharma question also. So, your brain is moving for the three subjects. Still, you don't know what examiner is trying to ask. And finally, the question is identify the level of prevention. And now I say, oh, ये तो अब community medicine का question आ गया. And if you read the choices, they are saying the primordial, primary, secondary, and tertiary. But you had not focused on these points. So now what you will do? You will read the question again. And again, you are reading to find out that what could be this level of prevention. So the simple question, you are reading twice means you are wasting your 35-40 seconds time more. So what question you can solve within 35-40 seconds, you are taking the 1 minute 40 seconds. So here as a smart attempt or as a smartness or the smart study, we have to focus on the time management. So my first message to all of you is try to read the last line first. Because from the last line and then read the choices, you are clear that what question they are trying to ask means it is related to what subject. One thing. Second thing is, if you read the choices, you are coming to know that from what topic and in that topic, from what subtopic they are trying to ask the question. So if I read my last line first, that identify the level of prevention, and if I read the primordial, primary, secondary, and the tertiary, now quickly the reel should play in your mind that what are these different levels of prevention. It will take only the 5 seconds time to just to recollect. Primordial means prevention of the occurrence or the emergence of the risk factor. Primary is the prevention of the disease in the presence of the risk factor. Secondary is the early detection of the disease, and the tertiary is the management of the complications and the prevention of the disability. So within 5 seconds, this reel is playing in your mind, okay, that what is this level of prevention. Now I could see that all of you are answering and there is a tie between the option number B and the C. Now, I know that this is a question of the community medicine. They are asking me the level of prevention. I know the different levels of prevention. Now, if I read the question, now I will try to find out the keywords by which I can say that what could be this level of prevention. Okay. So, even before going to this question, let me quickly summarize that what are the various levels of prevention. If you remember this table, and those who has attended my live classes, and they very well know that we discuss our content like in this tabulated form, in the question answers form. So if this table is clear to you, it is very, very clear to understand the concept of this topic. So if I say that in primordial, the risk factor or the agent is absent while it is present in primary, secondary, and the tertiary. Now, the disease is again absent in primordial as well as in the primary. In the secondary, the disease may or may not be present because we are trying to early detect the disease, or if you are doing a annual health checkup, we are trying to identify if the disease is there or not. But in the tertiary, definitely the disease is present. But if we see for the complications are only present in the tertiary level prevention, while if we talk about the disabilities may or may not be present in the tertiary level prevention. So this is the basic concept of various levels of prevention. So now coming back to the question. The question now, if I read the question from the top, that in the month of the March, a young gynecologist from the Rajasthan committed the suicide following the police case filed against her after the death of a patient due to the PPH. So there was a PPH and the patient died. But the question is to avoid such future accidents, means we are trying to avoid the PPH in future. The government made mandatory the prophylaxis use of oxytocin and the methogen after the each delivery. So as we know that here the main age risk factor is the pregnancy. Now we cannot avoid the pregnancy. Pregnancy is a physiological process, it is going to happen. So it cannot be a primordial level prevention because we cannot avoid the pregnancy. But yes, we can avoid the PPH by taking some measures prophylactically, as here the government is advising to use oxytocin and the methogen. So here we are trying to avoid the PPH, that is in the presence of the risk factor is the pregnancy. We are still trying to avoid the PPH, that is a condition, that is a disease. So this is none other than your primary level prevention. Okay. Now, if further specifically we say that it is what specific or health promotion, as here the government is advising. So it is for whole community. So it is a health promotion. Okay. So this is the way that how you have to solve the question. So my first tip is that try to read the last line first. Try to read the choices, and if the image is given, see the image, then you will be going to know that from which subject the question is asked, in that particular subject, which topic the question is being asked, or the subtopic the question is asked, what is exactly the question. So while reading the question, identifying the keywords, you are focusing on those important keywords, so you can save the time, because the time management is the most important step in your success in upcoming examination. Okay. Now coming to the next question. Now as questions is appearing like a big question, the choices are such a long, but we had studied the first step number, that we are going to read the last line. Now what the last line says, that it is the which vaccine can be given to a child at this age. So it means they are talking about the vaccine or the vaccination schedule. So if they are talking that which vaccine can be given to a child, so before reading the choices, because here the choices are such a long, so again you have to act smartly. You are not going to waste the time in reading the choices, because it will take more than a minute and still you will not come to the conclusion. So quickly the vaccination schedule or the national immunization schedule should flash in your mind, that at what age what vaccines we are giving. So here the two things should run in your mind parallel. One is that at what age or what vaccines are given, and the second is that the delayed vaccination means beyond that age, what vaccines we cannot give. So at that particular age, what vaccine cannot be started, and after that age, what vaccine cannot be given. So these are the two things which should run in your brain, of which you are trying to recollect simultaneously. So before reading the question, I'll just want to fresh up your information about the vaccination schedule. And I'm very sure that you all must know, it is just a recap or the revision, that if it is the hospital delivery, we are giving the BCG, 0 dose of the oral polio vaccine and the birth dose of the hepatitis B. If it is an home delivery, then only we are giving the OPV within the next 15 days, because we cannot give any injection at home. BCG has to be taken in the next visit, and hepatitis B birth dose is avoided. And at 6, 10 and 14 weeks, means at a minimum gap of the 4 weeks, we are giving the first, second and the third doses of the DPT, oral polio vaccine, hepatitis B, HIP, or you can see the pentavalent plus OPV, and the rotavirus vaccine, and the 6 and the 14 weeks pneumococcal vaccine, first and the second dose, and injectable polio vaccine, first and the second fraction dose. And then we are coming to the 9 month. So here the 2 points you have to remember, that what vaccines we have to give the birth, and 6, 10 and 14 what vaccines we are giving. And then we will be thinking that what vaccines we are starting at a 9 a month, because if a child is coming before 9 months, we cannot give the measles containing vaccine, we cannot give the Japanese encephalitis, we cannot start the vitamin A. This is the point which should be flashing in your mind. And very, very important point of the delayed immunization, we had studied that a rotavirus, that if a rotavirus has not started, even the first dose has not started till 14 weeks, 6 days, we are not going to start the rotavirus at all. And if any dose of the rotavirus is given before that, then the last dose can be given till 32 weeks. This is what we had studied. So keeping all these things in the mind, now coming back to our question. So this is the smart way, means while reading the last line, within the 10 seconds, everything should be coming in your mind, and then only you can focus on the keywords. Okay. So now the child is brought to the immunization clinic at 5 months of the age. This is a very, very important keyword, that the age of the baby is 5 months. Means quickly you had recalled that measles containing vaccine cannot be given, the vitamin A cannot be given, the Japanese encephalitis cannot be given, because it is out. It is a 5 months of the age. Okay. Now his parents are giving the history that a child had received only the birth dose of the vaccine. Okay. So child had received only the birth dose of the vaccine. It means, presuming that this is a hospital delivery, because nowadays the maximum deliveries are happening in the hospital. So quickly you are recollecting that baby had already received the BCG, baby had received the OPV 0 dose and the birth dose of the hepatitis B. Now here the most important is the BCG, because we know that BCG is given only single time. Okay, so it means the child had already received the BCG, one thing. Child had not received any vaccine at a 6, 10 and 14 weeks. So whatever the vaccines at that duration we are supposed to give. But another important point is that a child is coming after the birth vaccination at the 5 month of the age. What it means? That it is beyond the range of rotavirus start of the vaccine, because rotavirus we know that first dose should be started below 15 weeks, means 3.5 months, and here the baby is 5 months of age. So this thing is coming in your mind within 10-15 seconds, everything is flashing in your mind, and then only you can select the or choose the best answer or the correct answer. Okay, so we know that baby had received the BCG, we cannot give the rotavirus, we cannot start the measles containing vaccine, we cannot give the Japanese encephalitis and vitamin A. So this thing's in my mind. Now coming to the choices, the first is BCG. Child has already received the BCG, so this choice is out. I'm not going to read the whole choice. Why should I waste my 10 seconds to reading the whole choice? Because already the BCG has been given, so this is out of my way. OPV, then it could be. I'm not reading the further choices because I'm excluding the choices, then only I'll focus on 2 or 3 choices. So this could be a possibility. Again, this could be the possibility. And last is the rotavirus. Again, this is out because baby is coming at a 5-month. So rotavirus is not started. This is again out of question. So this is out. Now I have to focus on the two choices. Choice number B and the C. Now I'll see that what can be the answer. OPV, yes, in both. DPT, yes, in the both. Now rotavirus, again this is out because I cannot start the rotavirus. So if I'm not going to read the whole option of the C, that will be my correct answer, that OPV, DPT, hepatitis B, pneumococcal and the Hib. So this is the another tip or the message that you should learn the technique of exclusion. If you are going to learn the technique of exclusion, definitely you are going to save your time and you are going to come to the correct answer. Okay, so this is what is the immunization schedule, and very importantly they ask, so they can change the age of a baby, they can say the baby had received the previous doses, so like that they can modify the question, but concept should be clear in your mind. Okay, now coming to the another very commonly asked question is the contraindication of the various vaccines. And here mainly we are concerned with the live vaccines because we say that live vaccines are contraindicated in the presence of immunocompromised condition. So if I talk about this question, that pregnancy is considered as a immunocompromised state. So what vaccines are contraindicated in the pregnancy? We say that killed vaccines, the toxoid vaccines can be safely given in the pregnancy. All the live vaccines are usually contraindicated. But sometimes if required for a quarantine, for a purpose of quarantine, or for the purpose of person is traveling from the one country to another country, then we are giving the yellow fever vaccination. Okay, and rubella is considered to be absolutely contraindicated in the pregnancy. So if we go this a question that all the vaccines can be safely given to a pregnant woman except, and all of you are answering quite well that now some of you are answering the C also. Dear friends, if you had read this question, the vaccine that can be given safely to a pregnant woman, then you might be going with the tetanus toxoid, because here it is the most commonly used vaccine. But please, this is another very important message, that you are not supposed to miss the except or all or other keywords. So here they are asking which all vaccines can be given safely to a pregnant woman except. It means that we are going to look for the vaccine that is contraindicated. So we can give the rabies vaccine because it is your killed vaccine, can be given safely. Typhoid live vaccine, no, this is not given because it is a live vaccine to be avoided. Tetanus toxoid, yes, it is given. Hepatitis B vaccine, yes, it is a kill vaccine, it can be given. So here the correct answer is, it is the typhoid live vaccine. Now here I want to give another message that if a question is asked related to the contraindication of the vaccine in the pregnancy, now as the question remains the same, but if the choices are different, so your answer will change. So please mind my words that you are not going to mug up the answers from your practice session, and you have to choose the best possible answer from the given choices. Okay, so here I had specially framed this a question to make you understand this concept. Here the question is same, that vaccine contraindicated in pregnancy, and in the 3 exams the 3 different choices are given, and every time the answer is changing. Now if you see with the set of the first question, the vaccine contraindicated in the pregnancy, the hepatitis B can be given because it is a killed vaccine. The rabies can be given because it is a killed vaccine. The yellow fever, it is the live vaccine. So it is to be contraindicated, maybe the plus minus I'll say, because as we had said that in certain conditions we can give the yellow fever vaccine. tetanus is given. So here we have to apply the concept that all the kill and the toxoid vaccines can be given. The live vaccines are contraindicated. So here only the yellow fever is the live vaccine. So here the answer to this is that yellow fever is contraindicated. Now if we go with the second set of the question, that the question is saying the vaccine contraindicated in the pregnancy. That tetanus, yes, we can give. Yellow fever is again plus minus. Measles is again plus minus because both are the live vaccines, and rabies is a kill, can be given. So if we have to choose between the two kill vaccines, we know that yellow fever can be given in the certain situation. So here my answer will be the measles. That's why I say then don't mug up the answer. Clear? So here the answer is a measles because yellow fever can be given in the certain conditions. Okay. Now, if I come to the third set of the question, that question is saying that vaccine contraindicated in the pregnancy. The tetanus is, yes, can be given. It is a toxoid. Yellow fever is plus minus. The measles is again plus minus because it is a live vaccine. Rubella is again the plus minus, or I'll say absolutely minus because rubella is absolutely contraindicated. Okay. So here, if I have to choose out of the three live vaccines that which is contraindicated, I'll go with the rubella because it is absolutely contraindicated in the pregnancy. It can lead to the congenital rubella syndrome in the baby. So see that question is same, but with the choices your answer is changing. So this is a very, very important tip and the message that read the choices carefully. You are not going to mug up the answer from the practice session questions, and you have to choose the best possible answer from the given choices. Okay, sometimes may not be a correct answer, but it is the best possible answer from the given choices. Okay, so now coming to the another set of the question related to the contraindication of the vaccine, that mother brings her, again if I am going wrong, I should go with the last line. So one, which vaccine can be avoided by the doctor? Now with this I cannot get any hint, so I have to read the question from the top. Mother brings her 10-month-old child for the routine vaccination. Okay, so for the 10-month-old child, the routine vaccination, we know at the 10th month we are giving certain vaccines. Now she told to the doctor that my child has taken the tablet prednisolone for 8 weeks for some renal problem, and we know that this is an steroid, means the child has taken the steroid for 8 weeks for some renal problem, and we know if a child is on the steroid, usually the live vaccines are avoided. But the question says that now the baby had stopped since last 1 month. Again, we know the concept that minimum stoppage duration of the 2 weeks is enough to give the live vaccine. So if a baby had stopped the steroids minimum 2 weeks before, more is the gap, the better will be the opportunity or better will be the results. But after stopping steroid for minimum 2 weeks, we can give the live vaccine. And here the baby had stopped the steroids at least 1 month back. So now there is no contraindication. So can we give the vitamin A? Yes, we can give the vitamin A. Now here some of you are answering the B as the MMR. So this is what the trick and the message I want to give is that as the steroid has been stopped 1 month back, so now there is not a contraindication for the live vaccines also. So we can give the MMR also. It is not to be avoided because now the child is not taking the steroids. Pneumococcal vaccine booster, yes, we can give. So the correct answer is that none of the above to be avoided by the doctor, because here already the baby had stopped the steroids 1 month before. Now one more point I just want to highlight here, that a third condition where the live vaccines are contraindicated if a HIV positive mother has delivered a HIV positive baby, and in that HIV positive baby might be asymptomatic, but still the live vaccines are contraindicated as per the WHO guidelines. But in India, we are giving 3 live vaccines even to our HIV positive baby, and that is the BCG, oral polio vaccine, and the measles, because they say that we are having the high morbidity and the mortality related to these conditions, and baby will die earlier rather than remaining alive to be died with the HIV. भैया HIV से मरने से पहले ही वो बच्चा ट्यूबरक्लोसिस के कॉम्प्लिकेशन से, मीजल के कॉम्प्लिकेशन से मर जाएगा, या देयर कुड बी द ब्रेक इन द चेन ऑफ द हर्ड इम्यूनिटी, वी कैन हैव द recurrence of the polio back in our country, which we cannot afford. So we are giving these 3 live vaccines even to the HIV positive baby. So these are the contraindications of the vaccines, very, very commonly asked in the examination. Then coming to the another set of the questions, and this is from the area of storage of the vaccine. Again, this is a very, very important area, and very commonly the questions are asked from this. And we know that at the primary health center, the most important instrument where we are storing the vaccine is the ice line refrigerator, which is also called as a heart of the cold chain, of a temperature of the +2 to +8 degrees centigrade, and we are measuring its temperature by dial thermometer. Okay, so now coming to the first question, that again, if you read the last line, that he asked from his senior doctor that what to do, what is an advice. So I could not get any clue from the last line, so I have to read the question. Now, for giving the oral polio vaccine, the worker is taken out the OPV vial from the ice line refrigerator. Okay, so they are talking about the oral polio vaccine, this is one thing, and they are taking out from the ILR, that is the storage instrument. Suddenly, he noticed that a color of the inner square of the vaccine vial monitor is white. It means they are talking about the vaccine vial monitor, and the vaccine vial monitor color inner square is white. Now, he asked from his senior doctor about this, what is the advice of the senior doctor? It means they are talking about the vaccine vial monitor and its color, it means its grades, and we should be knowing that what are the various grades of the vaccine vial monitor, which grade we can use, which grade to be avoided. So quickly, if we see that what is vaccine vial monitor. Now actually this is a strip which is kept on the vaccines which are very heat sensitive vaccine, because this is having the inner square and outer circle. So inner square is coated with heat sensitive chemical, and in the fresh it is white, and outer circle is a light blue. So as this is exposed to the high temperature, it is changing its color. So it can be the light blue, but it is lighter than the outer one. So when this inner square is white, it is the grade 1. If it is becoming light blue, lighter than the outer one, it is the grade 2. So grade 2 and the grade 1 we can very well use. But if the color is becoming the same as the outer circle, it is a grade 3. And if it is becoming darker, it is a grade 4. So grade 4 and the grade 3 we have to discard. Now the question says that the inner circle is inner square is white. It means the vial is okay, it has not been damaged by the high temperature. So these are the various grades of the vaccine vial monitor, the grade 1, grade 2, this is the grade 3 and the grade 4. So we can use the grade 1 and grade 2, we have to discard the grade 3 and grade 4. So now coming to the question says that as the inner square is white, so what could be the advice of the senior doctor? That do not worry, give the vaccine. Yes, this could be the answer. But again, my message is, if you find the correct answer you think is the correct answer, in option number A, give 5 seconds more to read the other choices also. Okay, now discard the vial, use another new vial. No, there is no need to discard. The vial is absolutely fine. Use the vaccine but give the double dose. Again not. Then keep in the freezer. Will use tomorrow. No need for this. So here the correct answer for this is that do not worry. Give the vaccine, because vaccine vial monitor is giving a white color of the inner square. The vaccine is not damaged by the heat. Clear? Now coming to the another question. Again, with the last line, it is not clear what he should do. So we have to read the whole question. Doctor told the sister to bring the DPT vial for vaccination. Okay. He noticed that the sister is taking out the vial from the freezer. Now here, quickly, the real shit flesh in your mind that at what temperature the DPT is stored. The DPT is stored at +2 to +8 degrees centigrade. So it should not be in the freezer, because in the freezer we had a temperature less than 0 degrees centigrade. And we know that DPT is a vial which can be easily damaged by a low temperature. So it is a freeze sensitive vaccine. So if a sister is taking out the vial from the freezer, might be a possibility that this vaccine can be damaged. So here the examiner is trying to ask you the concept of the shake test, what we do to check for the freeze damage of the vaccine. So quickly we'll revise what the shake test, then we'll go through the choices. And shake test means that suspected vial which you are thinking is damaged by the low temperature, you are comparing this with the vial which has been intentionally kept overnight of the same batch in the freezer, and you are taking out and you are shaking both the vials and you are keeping for some time. If this vial, the test vial and the reference vial, so reference vial as it is intentionally kept will be damaged and will show the precipitate at the bottom. But if the test vial is also showing the precipitate either of a same speed or the faster than the reference vial, it means that vial is damaged. But if it is showing the uniform turbid solution, it means it is not damaged. This is what is the interpretation of the shake test. So now coming back to the question says that as we know that a vial is coming out from the freezer and we have to check whether this vial is damaged or not. All of you are answering very right that option number 4, but we have to read the choices. Can safely give the vaccine? No, we cannot give the vaccine safely because we had a doubt the vaccine can be damaged. Give the vaccine and observe the child for the adverse effects? No. Discard the vial? Again, we cannot discard until unless it is damaged and we have to check whether this is damaged or not. Then apply the shake test, and if the test is positive, discard the vial. So this is the correct answer. So again, the storage area is very, very important in the vaccine. So in the vaccine chapter, the 3 areas are very important. That is the national immunization schedule, the contraindications of the vaccine, and the storage and the cold chain of the vaccine. Again, the question from the vision or the blindness is very commonly they ask. They give you the vision of both the eyes and they ask you that what is the type of blindness. Okay, so here many of you make the mistakes. Now please listen carefully. Now first you have to see which is the better eye, and we have to go with the vision of the better eye, one thing. Now second thing is we should be knowing that from what vision to what is that particular level of blindness. So first we will be revising the various levels of blindness and then we'll coming to this question. As we had 2 criterias, the earlier classification when our cutoff of level of blindness was 6/60, then we had the different level of blindness as was the low vision, economic, social or the manifest blindness. But now as our cutoff is less than 3/60. So now what is a current guideline of blindness, that with the vision in the better eye with the best possible correction, if it is less than 3/60, then we call that person is a blindness. Okay, and below that we are having the simple blindness. We can see the category 2, 3, 4, 5, but we don't classify as a social, economic or the manifest. But yes, in the exam they are asking, so we should be ready for that. So if the vision is less than 6/60, sorry, if the vision is less than 6/6 to 6/18, then there is no visual impairment. But if the vision is less than 6 by 18 to 6 by 60, it is the mild visual impairment as per the new guideline and the low vision as per the old criteria. If the vision is less than 6 by 60 to 3 by 60, it is the economic blindness or the severe visual impairment. If the vision is less than 3 by 60 to 1 by 60, it is the social blindness. If it is less than 1 by 60 to the perception of the light, it is the manifest blindness. Okay. Now, if you are able to remember these three areas, then maximum questions related to the blindness is done, because maximum they are asking from these three vision areas. Okay. So now coming back to the question, what it is saying, that a person with a vision of 6 by 60 in the right eye and 3 by 60 in the left eye type of blindness. Okay. So here the better eye is what? It is the right eye or the left eye? The better eye is the right eye, where the vision is 6 by 60, because 3 by 60 is lower vision. This is one thing. Clear? Now another point is that they are not saying less than 6 by 60, it is 6 by 60. So if it is less than 6 by 60 to 3 by 60, then it will be coming in the economic blindness. Okay, as we had seen in this chart, if it is less than less than 6 by 60 to 3 by 60, it is coming in the economic blindness or the severe visual impairment, but they say it is 6 by 60. So it means it is coming in this category of the low vision or mild visual impairment. Clear? So here very, very clear that whether the vision is less or it is up to that point. Here it is 6 by 60. So it is coming into the low vision. If they say it is less than 6 by 60, it will be coming in the economic blindness. Okay. So this is the point where we have to focus very carefully to identify what is this level of a blindness. Clear? So here, as this is coming as in the low vision, so it is not an economic blindness, because it should be less than 6 by 60. It is not a social blindness, it should be less than 3 by 60. It is not a manifest blindness, it should be less than 1 by 60. So yes, it is the low vision. Okay. So read the question very carefully, that we have to go with the point that which is the eye having the highest level of the vision or better eye, and as per that better eye we have to identify. Clear? Now one more area from where the questions are asked from the blindness is the program Vision 2020. So we should be knowing that what are the diseases included in the WHO criteria, what are the diseases included in India, and remember one point, that onchocerciasis is included in the WHO disease criteria for the Vision 2020, while it is not included in the Indian criteria, and we are having the glaucoma, we are having the diabetic retinopathy, and we are having the corneal diseases in place of onchocerciasis in the Indian guidelines. And the third point, what is asked in the blindness section is, what is the cutoff level of the blindness? As we had already discussed, that vision should be less than 3 by 60 in the better eye with best possible correction. Then we can say that person is having the blindness. Now coming to the next area from where usually the questions are asked. And this area is the various types of pneumonia and its management at subcenter level. Now, if we read the question, that management protocol is. So, management protocol, again, I could not get anything from this. I have to read the question. A 5-month-old child reported to the subcenter with a complaint of fever and a breathlessness. So here my keyword is that a baby is coming, that is of the 5-month age. This is the first thing, that baby is coming of the 5-month age. Second is the baby is coming to the subcenter, because I know that in the subcenter we are not having the doctor, we are only having the multi-purpose worker. And mainly this is the function of the multipurpose worker male who is treating the patients. And the baby is 5 months. Why it is important to know the 5 month, the age of the baby? Because we are having the different respiratory rate of a normal range as per the age. And we know that in the first 2 months, 0 to 2 months, if a respiratory rate is less than 60 per minute is considered as normal. The 2 to 12 months, less than 50 is considered as normal. And beyond 1 year is less than 40 is considered as normal. Okay. So, age of the baby is important. Now they are saying that baby is coming with a fever and breathlessness. On examination, the respiratory rate is 55. Now, as we know that in the 5-month-old baby, my normal respiratory rate should be less than 50. Now, here the respiratory rate is 55, it means it is fast. So, the one point is baby is having the high respiratory rate, baby is having the fever, breathlessness, high respiratory rate, as well as there is presence of chest indrawing, means involvement of accessory respiratory muscles. So, I should be able to classify in my mind that what is the category, okay, of the pneumonia, in which grade of an IMNCI it will be coming, and according to that I'll be managing. So, quickly we will see that what are the various categories of the pneumonia. So, this chart we very well know, it is just a revision of this chart, that if a respiratory rate is normal, we consider as no pneumonia, but it is increased in the cases of pneumonia severe and the very severe pneumonia. Okay. Now, upper respiratory tract symptoms are present in all the conditions. Then, if a accessory respiratory muscle involvement is seen, it is only seen in the severe and the very severe pneumonia. It is not there in the no pneumonia or pneumonia. While the features of the shock, it is present only in the very severe pneumonia. It is not present in the other type of the pneumonia. And if you see the IMNCI category, it is the no pneumonia, it is your green category, and the pneumonia is your yellow category, and severe and the very severe is your pink category. So, now if you recall our question, and the question says that a baby is having the high respiratory rate, the chest indrawing, so it means the baby is coming as a severe pneumonia or the pink category of IMNCI. And we know that in the green category, it is the home management. The antibiotic and the follow-up, it is coming into the yellow. If it is improving, then continue the treatment. If no improvement, then we have to do the referral. Immediate referral, yes, it is there in the severe and the very severe. But again, my message is that if you find that this could be your correct answer, but don't stop here, because you may find the another googly ball sitting next to this choice. And if it is the antibiotics and then immediate referral, this is the best answer, because we have to give the pre-referral treatment and then we are going to refer. So, here the correct answer is D, and I am very happy that all of you are answering very correctly that it is the antibiotic then immediate referral. Now, again, very important area from where the question is asked is the biomedical waste disposal. And we know that there are the 4 categories. So, quickly if we revise that what are the various categories and what content are going in that, it is the waste is classified into the 4 categories, that is yellow, red, white and blue. Now, what content is going into the yellow category? Yellow means pila pus. So, anything which has been soiled or soaked with the blood pus serum is going into the yellow category. So, human anatomical waste, animal anatomical waste, the soiled waste, the chemical waste, microbiological waste, then cytotoxic waste is got soiled linen or disposable linen bed sheets. It is going into the yellow category. And one more important is empty blood bag is also going into yellow category. Now, the content which is going into the red category is all the red is lal lachila, means the plastic item which is recyclable, infectious, but it is recyclable. It is going into the red category, like gloves and all the plastic items like disposable syringes, plastic syringes, IV drip set, catheter, Eurobag, and all this is going into red category. Then in the white is safed, shiny, and it is the sharp items are going into the white category, and the blue category, it is the glass items as well as body implants are going into blue category, and the black is for the non-infectious simple domestic general waste. And one more point they ask is that what is the method of the disposal? The yellow content, what is non-recyclable, it is disposed of by incineration, while the content of the red, white and the blue, we are doing their disinfection, then we are breaking into the smaller pieces, that is shredding and mutilation, and then we are recycling those content. Okay, so this is a quick revision of the content of the various color bags and how we are disposing, and this is the sign, and this is your sign of the biomedical waste, and this is the sign of your ionizing radiations. Okay, now coming to the question is that a patient underwent laparotomy for ruptured ectopic pregnancy. Okay, after surgery, a plastic corrugated rubber drain was capped in the abdominal cavity. So the surgery was done, a plastic corrugated rubber drain was capped. On the day 5, the post-surgery, the drain was removed by the staff nurse. Sister is going to dispose of that corrugated rubber drain. So corrugated rubber drain, it is the plastic drain, and it is being disposed none other than in the red category. So the corrugated rubber drain is going into the red category. Clear? Now, another very commonly asked area is the treatment of leprosy. Now, this question is asked so many times in your FMGE exam also, in your Neet PG exam also, and recently in the INICET May 2022, this question was asked. And it's a very simple question. And as you could see, that these are the packs of anti-leprosy drugs. And earlier we were having the separate packs for the Possibacillary and the Possibacillary, just a minute, and Multibacillary drugs. But now we are using the same pack for Posse and Multi, but the difference is of the duration. Okay, so before going to this question, quickly we'll revise that what is the treatment protocol of Posse and multibacillary leprosy. Now, as per the national program of the leprosy, that is National Leprosy Eradication Program, now we are classifying the leprosy as Posse and multibacillary based on their skin lesions. Now, if the skin lesions are 1 to 5 in number, it is Possibacillary, and if it is more than 5, it is the multibacillary, and if the nerve involvement is up to 1, no or 1 is the Possibacillary, more than 1 it is the multibacillary. Now, the treatment is in both the categories. Now we are giving the 3 drugs, and the important is that how we are giving. Rifampicin is given as 600 milligram oral supervised once a month. Oral supervised once a month or directly observed once a month. It is the same in the cases of multibacillary. Now, Dapsone, it is given 100 milligram oral daily. So, 100 milligram oral daily Dapsone is given. Clofazimine, it is given in the 2 ways. Initially, we are giving 300 milligram oral supervised once a month, and then we are giving 50 milligram oral daily. This is how we are giving the 3 drugs, and the duration is different. We are giving for 6 months in the cases of Possibacillary, while we are giving for 12 month in the cases of Multibacillary. And for the follow-up, we are calling the patients of the Possibacillary yearly for 2 years, while in the Multibacillary, we are calling yearly for 5 years. This is what is the treatment protocol of Posse and Multibacillary. Clear? Now, one more point is that we are calling the patient once a month to the clinic, and once a month tablet of rifampicin and 300 milligram of clofazimine and the 1 dose of dapsone is given by health worker in his presence, and we are giving the packet, person is taking daily, and then we are telling them to bring the empty packet next time. This cycle goes on. So, this is how the pack is given, and this is the 1 tablet of dapsone. These are the 2 capsules of 300 milligram each of the rifampicin, and these are the 3 capsules 100 milligram each of the clofazimine. So, this we are giving on the day 1, and then in the next whole month, the person is taking these 2 tablets containing the 100 milligram of the dapsone and 50 milligram of clofazimine daily. And then the next month again the person is coming and bringing the empty blister pack and taking the new pack. But nowadays we are also having the provision of the accompanied MDT, means any responsible person from the family or from the village also can come and take the tablet on the behalf of the patients. Like if we are having any work in the bank, we can give the authority letter to anybody and who can do the transaction on our behalf. Same like the person who is responsible can take the tablets on behalf of the patient. So, okay. So, we know this basic information, and we know that now this pack is not used. We are using only this pack, that is a pack A, and we know that 6 months for the Possibacillary, 12 months for the Multibacillary. This we know. Now coming to the question. Now, in the question, we have to identify that what is this type of the leprosy. So, question says patient is having the 2 hypopigmented anesthetic patches. So, this is a 1 point. How many patches are there? 2 patches are there with 1 thickened nerve. So, 1 nerve is involved. So, obviously, what will be the type of the leprosy? It will be the Possibacillary leprosy. So, one thing is clear that it is Possibacillary. Second thing is we know that for how many months we are giving in the Possibacillary, we are giving for 6 months. So, here we are giving the packet A for 6 months. This is the answer what we had decided in our mind, and then we have to look for the choices. So, another one important message I want to give you, that around 60 to 70% of the questions you are having the direct question, means while reading the question you are knowing the answer and you have to find out that answer from the given choices. While in remaining 30% or 20 to 25% of the questions you don't know the answer, then you have to apply your knowledge of exclusion, and remaining 5 to 10% will be floating above your brain. आपको पता ही नहीं है, it could be the cellular level, it could be the genetic level. Then you have to attempt those questions very carefully. If you are an FMGE student, then yes, you can attempt because we are not having any negative marking. But if you are a Neet PG aspirants, then you have to attempt the question very carefully. Okay. So here we know that packet A I am using for 6 months. This is my answer. I have to just find out. So all of you are answering. Some of you are going with the answer C also. Dear, it is not for a 12 month because it is a Possibacillary case. So packet A for 6 months, yes, this could be the correct answer, but still we have to see the other choices. That is packet B for 6 months. No, because now it is not a guideline. Earlier we were using, but now not. We are using this a 2-date regime. Packet A for 12 months, no, because this is used for the Multibacillary leprosy, and packet B for 12 months, no. So here the correct answer for this is the option number A, that we are using the packet A for 6 months. Now, another very, very commonly asked area is the iron prophylaxis. We know that we are having a very important national program, and that program is Intensified Iron Plus Initiative or Anemia Mukt Bharat. Now, if we see the logo, now you could see in the logo itself, you could find that 6 beneficiaries are there, 3 and the 3. So this is the 6 beneficiaries of this program, and what are those 6 beneficiaries are? It is from the 6 months to 5 years, 6 to 10 years, 10 to 19, 15 to 49 years, pregnancy and lactation. Now here the question is asked is that what is the frequency of administration? This is one thing. And second is how much is the iron folic acid we are giving in this different age group. Now first, if we talk about the frequency, in the pregnancy and the lactation we are giving daily. Pregnancy and lactation we are giving daily. Now from 5 years onwards we are giving a weekly, but in the small children of the 6 months to 5 years we are giving bi-weekly. So this is a one important point that they commonly ask the frequency. Second point what you can remember is that from the age of 10 years onwards, this is the cutoff. From the 10-year onwards, we are using the adult iron tablet. And as per the national program, the composition of the adult iron tablet is having 60 milligram of elemental iron and 500 microgram of folic acid. While in the 6 years to 10 years, small tablet, it is 45 milligram of elemental iron, 400 microgram of folic acid, while the children of 6 months to 5 years, it is in the syrup formulation and it is 20 milligram elemental iron and 100 microgram of folic acid, what we are giving bi-weekly. So with this information in mind, now we are coming back to the question, and the question says that if I go with the last line, what is the dose of iron folic acid tablet for pregnant women? Now, if I am not going to read the whole question, I know the answer without looking for the choices. I know that dose of iron folic acid tablet is the adult tablet, 60 milligram of elemental iron and 500 microgram of folic acid. And the second point I know is the frequency is daily. So if I go with this weekly frequency, so these two choices are my out. This is how you have to act smartly. So these are the two choices my out because they are talking about the weekly. It is given daily. Then I have to look for that how much is the iron. So 60 milligram is common, but folic acid is 500 micrograms. So this is my correct answer. All of you are answering correctly. It is the answer B. But still, if I read the choice, read the whole question. Government of India started the Anemia Mukt Bharat or Intensified Iron Plus Initiative program with an aim to make India free from anemia, and the beneficiaries selected as the children from the 6 months to 19 years, reproductive, a female, pregnant and the lactating a woman. They are all talking about the program, but the main point is that what is the dose of iron folic acid tablet for pregnant women. So it is 60 milligram of elemental iron, 500 microgram folic acid, and the very important that we are giving daily. Now if we go with the another type of the question, same prophylactic iron supplementation to a 15-year-old girl. So again, this is an adolescent age group girl between the 10 to 19 years, is we are giving the adult iron tablet. And again, here the frequency is weekly. So my daily is out because here we are giving prophylactically as the weekly tablet. And this is an adult age group, so we are giving 60 milligram a weekly. This is my correct answer. Now, one point we have to remember, sometimes they ask one question like that all are the beneficiaries of this program except. So remember, if they say 0 to 5 years, it is a correct, not a correct answer, because 0 to 6 months, nothing is given. So if they had given you the choices that all are the beneficiaries of the Anemia Mukt Bharat except, and if your choices are 0 to 5 years, 6 months to 5 years, then 10 to 19 years and 15 to 49 years. So which is not a beneficiary is 0 to 6 or 0 to 5 years or 0 to 60 months, because first 6 months is exclusive breastfeeding duration. We are not giving anything from outside. So remember this point, because this could be another question. Now, another very, very important area from where the questions are asked is maternal mortality. Okay. So, before going to this question, we quickly recall what is the maternal mortality. The maternal mortality ratio, it is the MMR, okay, and it is expressed as number of maternal deaths per 1 lakh live births. Okay, this is one very important, because two of the questions has been asked. I'll come to that question just now, because two have the questions are asked, the straightforward questions, that MMR is what? A number of the maternal deaths per 1 lakh live births, and you all are correctly answering that it is per 1 lakh live births. Now, number of the maternal deaths per 1 lakh live births, this was the question asked in the last FMGE exam. It is a ratio, it is not a rate. Okay. Now, coming back to the previous question, that what is the maternal death? Now, maternal death means death of any woman from the conception till 42 days after the delivery. It means the next question comes here, that what periods are included in the calculation of the maternal deaths. It is the antenatal, natal and the postnatal. All the 3 periods are included. Then which is the most dangerous period? The most dangerous period is the postnatal period. Now, which is the most common cause of the maternal death is the hemorrhage. And we know if they say that which hemorrhage, it is the postpartum hemorrhage is the most common cause of maternal deaths, and the indirect cause is anemia, and that's why we are trying to improve the anemia by giving the prophylactic iron right from the 6th month of the age to avoid these maternal complications. Clear? And one more point is that these deaths could be either related to the pregnancy or it is aggravated by pregnancy, but it is not due to the accidental or incidental causes. Now, as I could see that here they had given you the various causes of the death, and this was the trap, and you all are trapped in that. Okay, you all are answering the C. Now, please see the question. What is the trap here? The question I am reading, as per the survey in the year 2020 in the Uttar Pradesh, per 10,000 live births, the maternal deaths are as follows. Okay. Now, due to the APH 10, eclampsia 5, the road accidents 2, rupture uterus 3, PPH 20. Okay. So, here the total of the deaths are 40. But as the 2 deaths are because of the road accidents, so if I have to calculate the maternal deaths, we have to exclude the accidental deaths. So, my maternal deaths are 38. Okay. Now, I had given you the hint and you had changed the answer. So, my question is that for calculation of the maternal mortality ratio, maternal deaths calculated as. Now, earlier what was happening, you all were calculating the maternal mortality ratio. So, you got the hint that here I am not asking you to calculate the maternal mortality ratio. I am telling you to calculate the maternal deaths only. So, Only the concept here is that out of the total deaths, you have to exclude the accidental deaths. Now, if I had been asking the maternal mortality ratio, then your answer will be the 380. But I am not asking you the maternal mortality ratio. I am asking only the maternal deaths. So, maternal deaths are 38 only. Now, those who are not excluding the road accident, they might go with the 40. That is not a correct answer. If you are calculating the maternal mortality ratio and excluding the road accident, you are going with the 380 where the most of you were doing earlier. It is wrong because question is not a maternal mortality ratio calculation, okay? And if you are not excluding the road accidents and calculating the maternal mortality ratio, you might go with the 400. That is also a wrong answer. So, my very important message is that your presence of mind on the day of examination is very, very, very important. Now, you have to be fully alert, fully conscious, and you have to read each and every word, because maximum or the most of the time they ask you to calculate the MMR and you are having the impression in that they are asking the MMR. But here the word is calculate the maternal deaths. So this is what the trap examiner is trying to give you, and they are trying to trap you. So we are not going to be trapped in the examiner's situation, okay? And for that, your proper sleep before the examination day is very, very important. So my one very important request to all of you is that those who had not changed their sleep pattern till now, that you should try to change your sleep pattern. You try to go to sleep by latest by 11 p.m. So you should be developing a habit of getting up at 5:30 or latest by 6 o'clock in the morning, and you should be fully energetic between the 7 a.m. till 5 p.m. okay? Because if your mind is alert, then only you can see these small keywords, because if you are missing a single keyword, your answer will change. And the examiner is very smart, because they know that you can avoid or you can skip this keyword and you can go in a wrong trap. And if you are going the answer on that trap, and if that answer is given in the choices, you are feeling happy, okay, I had solved a numerical and I have come to the conclusion answer, and that answer is given in the choices, and you tick and you go ahead. But when you come out from the examination hall, you may feel guilty. Oh, they had asked the maternal death, I had answered the MMR. So why to do these silly mistakes? So take a proper sound sleep, should be fully conscious to apply your knowledge, your hard work, what you are doing for the last 6 months minimum, but even more than that for the past whole 5-6 years of your medical duration, you are doing a hard work. So we should be able to utilize each and every concept in the examination, okay? So don't miss a single question because of these silly mistakes. So try to avoid these silly mistakes, and mind my words, if you are avoiding these silly mistakes, you are going to get 10 to 15 bonus marks in your upcoming examination, and really it is a game changer for your final outcome, okay? So this is about the maternal mortality, and 2-3 more points about that what is our goal. As per the Sustainable Developmental Goal 3.1, we have to bring down the MMR to less than 70 per 1 lakh live births by 2030. And as per the National Health Policy, that we have to bring down the MMR to 100 per 1 lakh live births by 2020. And we are very close to it, and recently the report came where the MMR of India has come down to 103 per 1 lakh live births, okay? And how we can reduce these this maternal mortalities by giving a good antenatal, natal and postnatal care. So remember these points. Now coming to another very commonly asked section is the pediatric mortalities, okay? And in the pediatric mortalities, we should be able to identify that what are these durations, their definitions, and how to calculate the mortalities if it has been asked. So quickly we'll be revising the various pediatric mortalities, although you might have studied in your pediatric classes also, that any death of the baby, if a baby is born alive and the death within the next 5 years is under 5 mortality rate, the death from the birth till 1 year is your infant mortality rate, from the birth till 1 month is the neonatal mortality rate, from the 1 month till 1 year is the post-neonatal mortality rate, from the birth till first week is your early neonatal mortality rate, and from the 1 week till 1 month, or some books they write the 28 days also, it is a late neonatal mortality rate, okay. And all these are expressed as per 1000 live births. But another very, very important is the perinatal mortality rate. Peri hota hai around, natal means the delivery. So any death, if it is starting from the 28 weeks of the pregnancy onwards, means intrauterine life, during the delivery process or within the first 1 week after the delivery, that is included in the perinatal mortality rate. So early neonatal mortality rate is a part of perinatal mortality rate, and it is also expressed as per 1000 live births. Now, if we say that as per the WHO guidelines, they are including this from 22 completed weeks onwards, okay. But in the India, we are not able to save such a low babies, so we are still considering our babies as from the 28 weeks onwards, and considering as perinatal mortality rate. So the question is that medical officer was conducting the delivery at the primary health center. Everything was going normal. The fetal heart rate was 144 per minute, but the baby had the shoulder dystocia and difficult removal, and the baby born as still baby. So here the baby died during the delivery process, okay. So this mortality will be included in the calculation of, obviously the baby died during the delivery process, so it is not an early neonatal, because in early neonatal the criteria is the baby should be born alive and then the baby will be dying within the first 7 days. So it is not a early neonatal mortality, okay. So this is out. Late neonatal, again the baby should be alive. Infant mortality, again it is not, because baby should be alive. So this is a criteria, or this death will be included in perinatal mortality. Clear? Then so some of you are answering A. So this is not correct. As for the early neonatal, as I said, the baby should be born alive, and here the baby is a stillborn baby, so the correct answer is the perinatal mortality. Clear? Now coming to the next question, that here they want to ask a concept from you, that you should be knowing that what periods are included in what mortality and how we are expressing that mortality. It is usually in per 1000 live births, okay. If you know this concept, then you can very well answer this question. So the next question is that in a village, the 1000 live births happened in the last 1 year. So one keyword is that how many live births happened is the 1000 live births happened in the last 1 year. Now 15 children died before 1 month of the age. So 15 children, they died between the birth till 1 month, while 5 more died between the 1 month to a 12 month. Now calculate the IMR, okay. So here the concept is you should be knowing that what is an IMR. Now I could see that some of you are going with the answer 5 as in B. Some of you are going with the answer correctly as the D, 20. Now here the 15 children who are dying before 1 month means this is your neonatal mortality, okay. So the neonatal mortality is your 5. Sorry, neonatal mortality is your 50. Then the 5 more are dying between the 1 month to the 12 months. So this is your post neonatal mortality. And we know that infant mortality is the total of neonatal as well as the post neonatal. So these infants who are dying is 20. Now we know that a definition is 20 infant deaths here out of how many live births. They had directly given me that it is the 1000 live births, so there is no need to do a further calculation. So here the answer correct is the 20. It is your 20 infants are dying per 1000 live births, so the infant mortality rate is 20. Clear? So another very important point is that in the examination, as we are not having the rough page and the pen to do the calculation, so if they are asking you the mathematical portion or some numericals, they are giving you the figures in such a way that if you are doing the simple mental calculation, you know the concept, you can give the correct answer. So here the correct answer is 20 because it is the combo of the neonatal and the post-neonatal mortalities. Clear? Now coming to the next question, because these are the different type of the questions which has been asked in the previous exams or which are also likely to be asked in the upcoming examination with some change in the figures, but the concept remains the same. Okay, so in a village with the population of 1000, the birth rate is 50 per 1000 population. Okay, so here the question says that how much is the population? The population is 1000. Now birth rate is 50 per 1000. So out of these population 1000, the live births are 50. 2 children died before their first birthday. It means less than 1 year. Out of these 50 children who are born, the 2 had died. So calculate the infant mortality rate, and we know that infant mortality rate is number of the infants dying per 1000 live births. Now those who are considering this 1000 population as a live births, they are going as 2, but that is not a correct answer. Okay, so here we know that 2 infants are dying out of 50 live births. So some of you are answering A also, some of you are answering B also 20. So here the 2 children are dying less than 1 year out of the 50 live births. So how many will be dying out of the 1000 live births? So here the correct answer is 40. So here the infant mortality rate is 40. Okay, I hope it is clear to you because many of you are answering 2 and 20. So 2, if you are considering that 1000 population as a 1000 live births. Okay, but here the live birth is 50. So out of this 50 live births, the 2 children are dying. So we have to convert this into the per 1000 live births. Clear? So 2 deaths per 50 live births. So how many will be in the per 1000 live births? That is the 40. So here the 40 is the correct answer. So read the question very carefully. That first, that the deaths, if it is given, of what duration. Second is how many are the live births had taken place, and out of those live births how many children are dying. Then only we can calculate the various rates. Clear? Now coming to another area where the questions are asked related to the growth monitoring in the ICDS centers. Okay, so coming to these questions, quickly we will see the growth charts and its interpretation. This is the ICDS growth chart or MGRS growth charts, multicentric growth reference study chart or ICDS growth charts. And these charts we are using in the ICDS centers, and we know that main worker of the ICDS center is the Anganwadi workers. As in the pediatric subject, you might have studied the chart where we are going towards the upper side also. But our purpose of detecting the undernutrition is main in the ICDS centers. So this growth chart is having only the 3 lines. And the question is asked is what these lines are representing. Now which area we consider as a normal child or which area is considered as a undernourished child. So the first line, it is representing the 50th percentile. First line is representing the 50th percentile. Second line is representing the -2 standard deviation. As we are not on the upper side, it is on the lower side. -2 standard deviation, or we can say it is the third percentile. Now the third line, it is representing the -3 standard deviation or first percentile. And we know the basic fundamental of the statistics, that any value between the mean plus minus of the two standard deviation is considered as normal. So towards the lower side, it is the still second line, means in this green zone, if any weight is coming of the baby, it is considered as normal. Between the second and the third line, it is a mild to moderate undernutrition, and below the third line, it is a severe degree of undernutrition. Okay, and this is actually a line chart where we are showing the relationship between the two parameters, and that is age we are considering on the x-axis and the weight we are considering on the y-axis. Okay, because why we are taking the weight to the age? Because it is suggestive of both acute and chronic malnutrition. Okay, now if you are considering the weight only for the height, it will be suggestive of only acute malnutrition. If you are taking height for the age, it is suggestive of only the chronic malnutrition. So the best parameter we are taking is, it is the weight for the age, because this is giving us an idea about both acute and chronic malnutrition. Okay, so with this knowledge, now we'll be coming to our questions what are commonly asked in the examination. Okay, so the first question is that in the ICDS centers, the Anganwadi workers are posted covering the 1 per 800 population in the plain area. These centers are mainly concerned with the well-being of our children 0 to 6 years. The growth monitoring is a very, very important function of these centers, and according to the ICDS growth charts, which babies are considered as normal. Now, as our protocol, if I am going to read only this line, then I can answer. The rest, they are talking about the ICDS centers only. So according to the ICDS growth charts, the which babies are considered as normal, we had right now discussed that the babies above the second line, that is a -2 standard deviation, are considered as normal. So below the, so if I am coming again to this chart, just remember that above the second line, these babies are considered as normal. Below the second line, these babies are considered as abnormal. Clear? So now coming to the choices, that above the first line, yes, first line may be the normal babies, but green zone babies are also normal between the first and the second line. So below the first line, again not, because the green zone babies are normal. Below the second line, it is abnormal babies. Above the second line, yes, these are the normal babies. So here you all are answering very right. It is above the second line. So read the choices very, very carefully. Here we require the presence of mind, common sense. Okay, so as we say now that you are having the surplus knowledge, we are having the knowledge of the content more than what is required to pass this exam, to get a good score. Only you have to apply this knowledge with your relaxed brain, your calm mind in the examination. Okay, and you have to act smartly, you have to reconcentrate, you have to recollect your information, and for that your brain should be alert. Like you might have seen that whenever you are using any mobile phone or you are using any computer, क्या होता है, बहुत ज़्यादा उसमें मेमोरी होती है तो हैंग होने लगता है. So what we do, we just stop or shut down and then restart. So our brain is like a supercomputer. If you are studying so much, then it can get exhausted. So in between, you have to relax your brain for a 5 minutes. Just relax, take a deep breath. You can do a 1 or 2 pranayams like a Brahmari pranayam. It's a very effective. It will take hardly 1 or 2 minutes. In this, you have to just close your ears, close your eyes, inhale deep and try to exhale, making a sound that will be creating a vibrations on your brain. And when you open your eyes after 5-6 rounds of this, you feel that you are coming out from a different world. So your brain is relaxed. So this is a supercomputer. It needs relaxation in between. Okay, and this is only the impact of your fresh mind that you can solve these type of questions, which appears to be quite difficult, but they are not difficult. Clear? Now coming to the next question, that in the Icds growth chart, the data presentation method what we are using. Okay, and as we had already discussed right now, that here we are comparing the weight and the age. So this is your quantitative data, and we are using the relationship or showing the relationships between the two parameter over the time. So it is the line a chart. It is not a bar chart, because bar chart is used for qualitative data presentation. Okay, and pie chart, again, it is not, because it is for the qualitative data presentation where the total is of 100%. Now I could see that some of you are answering the C also, some of you are answering B also. Dear, it is not a bar chart or the pie chart, because it is for the qualitative data, and this is the quantitative data. It is not in histogram, because we are not showing back to back. It is not a continuous data. Okay, so it is not a histogram, because histogram is used for continuous quantitative data, while here we are showing the relationship between the two parameters over the time. So this is your line chart. Now another question is related to these growth charts is the best parameter for growth monitoring in the Icds centers. As we had discussed right now, if we are discussing the low weight for height, it will be a suggestive of only the acute malnutrition. If we are having the low weight for age, it will be suggestive of both acute plus a chronic undernutrition. If we are considering the low height for age, it will be a suggestive of only the chronic undernutrition, and you all are correctly answering that it is the weight for age that is suggestive of both acute and chronic malnutrition. So this is the best parameter which we are using for growth monitoring. Now another very commonly asked area is the caloric requirement. Caloric requirement depends upon the work, if it is a sedentary worker or if it is a moderate or the heavy worker. And then we know some extra calories are required in pregnancy and lactation. Okay, so before answering these questions, quickly recap the caloric requirement. Now here I'll be giving you the trick how to remember, and I'll be giving the values, not exactly what has been written in the textbooks, but nearer values in the round figure. So it is very simple for you to remember. Okay, so if you can remember the basic values for the sedentary workers for both male and female, then you can remember all. Okay, so if I go with the caloric requirement of sedentary worker female, it is your 1700 kilocalories. Now trick is that you have to add plus 4, that is 2100. It is for moderate worker female, and you have to add plus 6, that becomes 2700 kilocalories for the heavy worker female. Now if you go with the male, it is 2100 is for sedentary worker male, and if you are adding plus 6, that is 2700 kilocalories for the moderate worker male, and just add plus 8, that becomes 3500 for the heavy worker may. Now, this is what are the basic calories required. Now, what is an extra calories required? This is again very commonly asked question, that extra calories required in the pregnancy is plus 350 and in the lactation first 6 months is plus 600 and more than 6 months is plus 520. So, keeping this basic information in your mind, now we come to the questions. Okay, and the question says, this is the first question. A housewife delivered in the district hospital 3 months back. So it means the delivery has taken place 3 months back. She had obstructed liver, but anyhow, by doing the cesarean section, her life was saved, but the doctor could not save the baby. Now calculate the caloric requirement of this sedentary worker. So one keyword is that worker is the sedentary worker who delivered 3 months back a stillborn baby. Now calculate the caloric requirement. We know that how much is the calories required by a sedentary worker and how much are the calories required in the delivery, post-delivery in the lactation area. So I could see the choices coming between A and B, and this was my trap, and many of you are being trapped here. Now, please read the question. The baby is stillborn baby. Stillborn baby means the baby is dead. So baby is dead at the time of the delivery only. So although she is in a post-delivery phase of 3 months, but as the baby is dead, she is not lactating. So there is no need to add the extra calories. Now what you are doing, that you are very right, it is the sedentary worker. So basic calories required is the 1700 and most of you are adding 600 in that, thinking that 3 months post delivery, and you are coming as answer 2300. That is a wrong answer because the baby is the dead baby, stillborn baby. So we are not supposed to add the calories required. So here she will be needing only the basic calories. Okay, so this is clear? Great. So this is how the examiner gives you the tricky questions. And as I said, that everybody of you are having the basic knowledge, basic concept, but if you smartly read the question, smartly attempt the question, your answer is correct. So remember the words that the winners are not doing or not reading the something different, but they are doing in a different way, and that is a different way is their reason of their success, of their win. Okay, so you have to be approaching in a different way, and how you can approach in a different way if your mind is open, mind is fresh, relaxed, and you can read each and every keyword in the given question. Okay, so even a single keyword is changing your answer, and here the answer which is being changed is by the stillborn baby. This is the keyword. Okay, so now coming to the next question. A baby delivered, a healthy baby with birth weight of 3.2 kilograms by the vaginal route. On discharge, the doctor advised her to breastfeed the child for a minimum 6 months. They calculate the extra caloric requirement by this lactating woman. So extra caloric requirement by this lactating woman who had delivered the 3 month back and is heavy worker by occupation. And again, some of you are being trapped, and some are answering B and some are answering D. And here the trap is, although she is a heavy worker and the basic requirement for the heavy worker will be 2700, and we know that extra calories will be the 600 calories because she is in a post 3 months of the delivery. But the question is that they are only asking the extra calories. They are not asking the total calories. If they had asked the total calories, then your answer should be this one. But here, my dear friends, they are asking only the extra calories. So your answer is B, that is the 600 calories. Okay. So here the keyword is extra. If they ask the total calories required, then your answer should be the 2700 plus 600. But here they are asking the extra calories. So extra calories in the first 6 months of the lactation is 600 only. So the correct answer is 600. So see how the examiner is twisting the question. Basic simple question, simple twisting, but we have to learn these tricks, that how to come up with this twist and how to come up with the correct answer. Clear? Now, another very commonly asked area is identify the various type of the studies. Okay, many questions has been asked from this, so I tried to give you the 4-5 examples of these different studies. But before moving that, I just want to revise that how we are going to do the identification of the various studies. Okay, so we have to look for the two very important points in the identification. Okay, the first is what is the direction at the start of the study or not. So if we go with the direction of the study, if the direction is a backward, it is your case control study, and if the direction is a forward, it is your a prospective cohort study. If starting from this point, we are going little bit back to the point where it is healthy, and then coming forward, it becomes your retrospective cohort study. And if you are studying at that particular moment, it becomes your cross-sectional study. Okay. And if you are able to find out the outcome is absent only in the prospective cohort study at the beginning, while it is present in other type of the studies. So keeping these 2 points in the mind, now we'll be seeing the various questions, and we will try to identify the various studies. So this is a first question. What is the type of the study? So try to identify the association between the low birth weight and the maternal smoking during the pregnancy can be studied by obtaining the smoking history from the woman at the time of the first prenatal visit. So now here the words are, or the keywords we should try to catch is that they are taking the history, smoking history. Okay. From the woman at the time of their first prenatal visit. And then what we are doing, that we are subsequently assessing the birth weight at the delivery and trying to correlate the smoking to the birth weight. So here, although the history word is given, but what is the direction they are moving? They are starting from the prenatal or antenatal period, and they are moving till the delivery. So they are going in a forward direction. So this is your prospective cohort study. Now some of you are going as a retrospective. No dear, it is not a retrospective. They are not saying that patient has delivered first and then they are going back. No, they are starting the study from the first antenatal period and then they are coming forward. So this is your prospective cohort study. Clear? That's why this is a little bit a confusing section. I had taken 4-5 examples for this to make you clear all these different type of the studies. Now another example is to know the effect of tobacco use on the birth weight of a newborn. A study was designed on the delivered mothers. Now here the baby is already with us, we know the birth weight. Delivered mothers are there, and now what they are doing, their history of the tobacco intake was reported. So what they are doing, they are starting a study when the mother has delivered, and what they are doing, they are going back and they are trying to take the history of the tobacco. So here the baby had delivered, they are going back, so the direction is backward. So it is the case a control study. Okay. Now you are asking Zen that the word history is given in a previous question. Yes, when the patient is coming or the pregnant woman is coming, we are taking the history, personal history, that whether she is a smoker, she is alcoholic, and then we are following that lady. So here don't go with the history that we are taking a past history. We are taking a history and then moving forward. That's why it is a prospective cohort study. Clear? Now coming to the next set of the studies. To know the prevalence of COVID infection in the community, a team of health workers visited that area and a nasopharyngeal swarm of 500 individuals were collected randomly for RT-PCR. What type of the study is? So, what particular point only, they had collected the nasal swab for RT-PCR. So, it is the study at that particular point only. So, it is the cross-sectional study. Clear? Now coming to the next, a study started in the month of February 2022 where the labor room records of the patient admitted in the month of January 22 with the labor pain was analyzed to know the effect of oxytocin use for the induction or augmentation of the labor to the neonatal outcome. The type of the study. So here see the words. Now study started in the February 2022 and what they had done, that they had taken the records of the patients admitted in the January 2022. So obviously from the February they had gone little bit back to the January record. So they had gone back and obviously the patient is in the labor room in the January must have delivered. So they are starting once the patient had delivered, they had gone back to the records of their delivery time and they are analyzing that what is the effect of the oxytocin on the neonatal outcome. So they are going little bit back and then coming forward, and all of you are correctly answering. It is the retrospective cohort study. Clear? The next is, if you want to check for the incidence of the cardiovascular disease in the post-COVID patients after 2 years, study conducted will be. Now here again the catch is that if you are not able to identify the study by the direction, if a parameter is given and here the parameter is the incidence, and we know that incidence is calculated by which study? It is calculated by a cohort study only. And if you try to identify the direction that they say that try to check for the incidence of the cardiovascular disease in the post-COVID patients after 2 years. So they are going in a forward direction. They are trying to calculate the incidence. So you all are answering very correctly. It is your cohort study. So in this way, we can identify the various type of studies. Now coming to the next area where they ask the parameters calculated by the various studies. Clear? And quickly we will revise that what are the various parameters calculated by the studies. By the case control study, the parameter calculated is odds ratio and it is also known as the cross product ratio, and the formula is AD upon BC. By the cohort study, the parameter calculated is the incidence, then relative risk or the risk ratio, and the formula is, it is incidence in exposed by incidence in non-exposed. Incidence in exposed by incidence in non-exposed is the relative risk or risk ratio. Then we can calculate the attributable risk or the risk difference, that is incidence in exposed minus incidence in non-exposed by incidence in exposed. As well as we can calculate the population attributable risk, that is incidence in total minus incidence in non-exposed by incidence in total. So these are the various parameters what we can calculate with the various studies, and by the cross-sectional studies, we can calculate the prevalence. So these are the parameters we should be knowing. And one more point before going to the question, that the strength of association between the disease and the risk factor can be assessed by the odds ratio as well as by the relative risk, but the better is the relative risk. Okay, so with this information, we'll be coming back to the question, and the question says that in a study, it was reported that history of the OCP use was 5 times higher in the patients of the deep vein thrombosis than the normal individuals. The parameter calculated with its value. Now here 2-in-1 question is asked. That one is that you should be knowing that what type of the study is, and the second is you should be knowing that what parameter is calculated by this study. Okay, so some of you are answering it is the odds ratio, some of you are answering it is the population attributable risk. So first try to identify the study. Now the question says that in the patients of the deep vein thrombosis, they are asking the history of the OCP use. So they are going in a backward direction, and the OCP use was seen 5 times higher in the deep vein thrombosis. So first thing is that this is the case control study, and we know that parameter calculated by the case control study is odds ratio. If you are not able to identify that this 5 times what is the value, but if you know that this is the odds ratio and relative risk is not calculated by case control, then attributable risk is not calculated by case control, population attributable risk is not calculated by the case control, it is only the odds ratio, and here 5 is representing the odds ratio. So this is your correct way to approach, and correct answer is odds ratio, and that is the 5. Now another simple straightforward question is parameter calculated by the prospective cohort study. We all know that it is the relative risk, yes. So again, my mantra that don't stop here, you have to read the other choices also, that it could be attributable risk, yes, it is also calculated by the prospective cohort study, population attributable risk, yes. So the correct answer is, it is all of the above, clear? So this way that we should be knowing what are the various parameters calculated by various studies. Then coming to the next question is the formulas of the various screening values. Now, as you all know that I had given you a very simple trick how to remember the formula. So quickly first we will revise the formula, and we all know that sensitivity is a true positivity. Now if the numerator is the true positive, then the denominator will be opposite, true positive plus false negative. This is your formula for sensitivity. Now what is the formula for your specificity? We all know it is the true negative. So numerator is the true negative, opposite will be the denominator, it is the true negative plus false positive. Okay. And for the positive predictive value, as I said that it is all positive. So it is the true positive by true positive plus false positive. It is the formula for your positive predictive value. And what is the formula for the negative predictive value? All negative, that is true negative by true negative plus false negative. So if we had this information in our mind that these are the formulas how to remember, then quickly we can identify the correct answer. Okay. So what is the formula for positive predictive value? Now some of you are answering B also, dear. Let us see. As I said that positive predictive value all positive, so numerator should be positive. So first this is out, this is out, because here it is true negative. So we have to focus only for these two choices. Okay, because it is numerator is true positive. Now looking for the denominator should be all positive. So it is true positive plus false negative. This is not a formula for positive predictive value because this is a formula for your sensitivity. So the correct answer is option number C, that is true positive by true positive plus false positive. Okay, so remember this trick that all positives is positive predictive value, all negative is negative predictive value. Opposite to the numerator positive is the sensitivity, opposite to the numerator true negative, in the denominator is the specificity. Now, what is the formula for specificity? We all know that we have to look for the numerator is the true negative. So, this is out, this is out. Now, we have to look for only these two choices, the true negative by true negative plus false positive opposite. So, yes, this is my answer or formula for specificity, because this is my formula for negative predictive value. Clear? Now, another very commonly asked area is that what happens if we are changing the prevalence, and what will be its effect on sensitivity, specificity or predictive value. So, before moving to these questions, just revise the concept that if a same test is applied in the different areas, the test is having the inbuilt quality of fixed sensitivity and specificity. It will not change if you are applying in a different areas. So, if we are applying in a different areas with the difference of the prevalence, then only the predictive value will change. Okay. So, if we are increasing the prevalence, the positive predictive value is increasing. So, there is the direct relationship between the positive predictive value to the prevalence of the disease. So, prevalence of the disease is directly proportional to the positive predictive value, but it is having the inverse relationship with the negative predictive value. So, negative predictive value is inversely related to the prevalence of the disease. It means if you are increasing the prevalence, the positive predictive value will increase and negative predictive value will decrease. So, this is a concept, keeping this concept in mind, coming to the question that a test with a 90% of the sensitivity and the 80% of the specificity applied on population with the disease prevalence of 10%. Clear? Okay. So, in one they are applying where the disease prevalence is a 10% and the test sensitivity is 90% and the specificity is 80%. The same test is applied on a different population with the disease prevalence of 20%. So, here the prevalence has been increased. The parameters affected are only sensitivity, only specificity, only predictive value or all. Okay. So, what could be your answer? Now, here as I said that same test is being applied. So, it will not affect the sensitivity. Sensitivity will remain the constant. It will not affect the specificity. Only the predictive value will change. As the prevalence is increased, so what will happen? The positive predictive value will increase and the negative predictive value will decrease. You all are answering quite right that it is only predictive value will be affected. Now, if we go with the next question, that predictive value of a test depends upon. So, predictive value of a test will not only depend upon the prevalence, but it is also depending upon the sensitivity and the specificity. So, here the correct answer is that it is depending upon all of the above. So, no confusion. Now, if simply they ask that predictive value of a test, it will depend upon the test sensitivity also, test specificity also and the prevalence of the disease also. But if we are using a one test having the fixed sensitivity and specificity, and if this test is applied in another area with the difference in the prevalence, then sensitivity specificity will remain constant and the predictive value will change. You can remember like this, that if you suppose your height is 6 or 5 feet 6 inches, if you are standing in front of a 6 feet person, you will appear as a shorter. But if you are standing in front of a 4 feet person, you will be appear as a taller, but your height is constant. So, same like a test sensitivity and specificity is a inbuilt criteria of a test, it will always remain constant. But if you are applying in a different areas with a different prevalence, the predictive value will change. Clear? Now, coming to the next area, and these are the demographic parameters. Now, in the first question, they ask you to calculate the dependency ratio. Dependency ratio. So, quickly we should be having the formula in our mind. Now, what is the formula for the dependency ratio? Dependency ratio is nothing but it is the ratio of the non-working to the working population. And what is the non-working population? It is less than 15 years plus more than 65 years. And what is the working population? It is between 15 to 65 years. Okay. So only the catch is you have to identify what is the population in this age group. So in a population of 10,000, so some are answering 0.8, 0.8. Okay, there it is not a correct answer. So in a population of the 10,000, the 8,000 are between 15 to 65 years. So between 15 to 65 years, my population is 8,000. So out of the 10,000, if my 8,000 is between 15 to 65 years, obviously the remaining 2,000 will be either less than 15 years or more than 65 years. So my non-working population is 2,000. So 2,000 is my non-working population and my 8,000 is the working population. So my dependency ratio is 0.25. Okay, so I think you all got the concept. It is not the 0.2 also. Those who are coming to the 0.2, it means they are not excluding this working population from the total to get the non-working. Okay, so it is 0.25. Now coming to another question is calculate the literacy rate. Again here, before solving this question, we should be knowing what is the literacy rate formula, and only the catch here is that we should be knowing the definition of the literacy rate. It is number of the literate person, and the most important is the denominator, and denominator should be equal or more than 7 years. This is one thing. And second is, so this is the literate person, and the multiplying factor is 100 because it is expressed in percentage. So these are the two important points what we have to remember. Now coming to the question, in a total population of 10,000, in a total population of 10,000, the children below 7 years are 2,000. So obviously above the 7 years will be 10,000 minus 2,000. It means the 8,000 population is above 7 years. This is clear? This is only the catch here. And out of this 8,000, how many are literate is 4,000. So all of you are answering quite correct that it is 4,000 is the literate people out of the 8,000. So the literacy rate is 50%. Now those who are thinking as it is 500 per 1,000, 50% we can write as a 50 per 100 or 500 per 1,000, but the better answer is 50% because literacy rate is expressed as percentage or per 100. Clear? So correct answer is 50%. Now another very commonly asked is the sex ratio. Now another question is that in a population of 1,000, the sex ratio is 1,000. The correct statement is. Now as we know that population is 1,000 and the sex ratio is 1,000. It means equal is the male to female. So what is the sex ratio? It is number of the female per 1,000 male. This is my sex ratio. I know this, okay? And here I say my sex ratio is 1,000 and the total population is 1,000. It means if my population of the female is 500, equal is the male also, then only I can say my ratio is 1,000. Clear? So my female population is 500, my male population is 500, then I can say my ratio is 1:1 or 1,000 into 1,000. Clear? So here we have to go with the correct answer. You all are answering very right that the female are 500 and male are 500. If a male are less than 500, it means the female are more than 500. It means my sex ratio is favorable more than 1000, but it is not there. If a female is less than 500, it means my sex ratio is less than 1000. Unfavorable, it is also not the situation. If I say my female is 1000 and male is 1000, my total population will become 2000. But they say the population is 1000 only, so again this is not an answer. So correct answer is, it is female 500 to male 500. Clear? Now coming to the next question, that again these are the demographic vital indicators very commonly are asked in the examination. These are the definitions. Now question is, a 30-year-old woman delivered the 3 live children in past 10 years. Here the 3 is representative of. Now we know that what is the GFR? GFR is general fertility rate. And how we define the general fertility rate is number of live children per 1000 mid-year population of reproductive age group women. So they are talking about only the one woman. So it is not a GFR. TFR is, you can remember T for total. Yes, they are talking about that how many total live children born to a woman. So they say that 3 live children are born to a woman. It is the TFR is the 3. As they had not mentioned how many are the girl children, how many are the boy children. If they say that out of these 3 live children, the 2 are the girl children born alive, then your GRR will be 2. So number of the girl children born alive to a woman in the entire reproduction is the GRR. And NRR is the net reproduction rate. How many of these girl children are remaining alive till their own reproduction is the net reproduction rate. And the most important demographic parameter is the NRR. And our goal of achieving the NRR is 1. And for achieving the NRR, our TFR should be 2.1. And to achieving the TFR of 2.1, our couple prediction rate should be more than 60%. So these are the few more commonly asked questions. Okay. So here the correct answer is TFR. You all are answering very right. Now the next is the number of the live births per 1000 mid-year population of a woman in the reproductive age group is none other than what we had already discussed. It is the general fertility rate. Now what is the crude birth rate? It is the number of the live births per 1000 mid-year population, whole population, not in the reproductive age group. What is the general marital fertility rate? It is, if you are counting the live births in the married woman of the reproductive age group, it is the general marital fertility rate. So here the correct answer is, it is the general fertility rate. Now coming to the next question, again the contraceptives are very, very important. So the question is that in a survey, it was noted that 5% of the eligible couple are newly married couple who want to delay their first pregnancy for 1 year. So here the 5% of the couple are eligible couple. And who are the eligible couple? Eligible couple are those couple where the age of the wife is between 15 to 49 years, means she is at a risk of having the pregnancy, and we should advise them the contraception. And they are talking about that newly married couple, they want to delay their first pregnancy. So the best contraceptive for delaying the first pregnancy, it is none other than OCPs. You all are answering very correct. It is oral contraceptive pills. IUCDs are preferred for birth spacing, means after the first child, if we want to delay the second baby for the birth spacing, we are going with IUCDs. The condoms are preferred for the young adolescent because it is protecting against the STDs. Now, Chaya is given to the post-delivered patients who are not willing for the IUCD. So we can give the Chaya. It is a non-hormonal oral contraceptives. It is safe in the lactation also. Okay. So here the correct answer is, it is the oral contraceptive pills. Now another very commonly asked question about the contraindications of IUCD. Now as you could see that this is the given image is the copper T, and how you could see the copper T, that the thread is visible here and it is the T-like structure, and you could see the copper on both the arms vertical and the horizontal. So this is none other than copper T 380A. So this is your copper T 380A. Now coming to that, all are the contraindications of the device given in the image. Irregular vaginal bleed, yes, this is an absolute contraindication. History of ectopic pregnancy, past history, again this is an absolute contraindication. PID, existing PID is again an absolute contraindication. Anemia, it is a relative contraindication. So as I said that we have to choose the best from the given choices, although anemia is also a contraindication, but it is relative in comparison to the others. So here the answer is anemia. But remember, please listen carefully. If I say that in place of, suppose anemia is also there in the choice and we are not having the PID, and the next choice is, it is the lactating woman. Lactating woman, in that case, the anemia is also a contraindication which is relative, but lactating woman is not a contraindication for the IUCD. In that case, your answer will be the lactating woman. So please remember that we have to choose the best answer from the given choices, and sometimes it may not be the absolutely correct answer, but it is the best from the given choices. Clear? Now quickly revise the various IUCDs. This could be your image based questions, that this is the Contra, this is the hormonal injection, this is given every 3 months, this is the Assure implant, and this is inserted hysteroscopically, and on the both the bilateral corneal ends we are putting this implant. This image has been asked 2-3 times. This is your again intrauterine device, but we cannot say it is an copper T because it is not having any copper, but you could see the bulge in the vertical arm. So this is your hormonal IUCD, and this is Mirana, and this is also called as LNG20. The another image, it is the Chaya. It is non-hormonal oral contraceptive safe in the pregnancy, and this is your Mala N, which is a combined oral contraceptive pills. It is available free of the cost from the government centers. Okay, so out of this, the Assure implants and the Mirana, it is not available free. The rest of the contraceptives are available free from the government setup. Okay, in the Mala N, 2 more points I want to highlight. They ask that what is the mechanism of action? It is inhibiting the ovulation. And the second is what cancers are increased and the cancers are decreased. With the use of Mala N, there is a possibility of an increase in the breast cancer, the cervical cancer and the hepatocellular cancer, and there is a possibility of a reduction in the ovarian cancer and endometrial cancer. Now coming to the next is healthcare workers. Again, a very important section, and many questions has been asked from these workers. So the question is, if we read the last line, that to whom he is referring as madam. We cannot guess anything. So we have to read the whole question, and the question says that a mother-in-law brings her pregnant daughter-in-law to the subcenter for the TD vaccination. So they are coming to the subcenter. So we should be knowing that what workers are posted in the subcenter. It is the multi-purpose workers, male and female, are posted. Now guard of that center told that to wait for 20 minutes as the madam is conducting the delivery. So the type of the multi-purpose worker who is involved in the MCH activity conducting the delivery is the multi-purpose worker female. So to whom he is referring as the madam? So obviously he is referring the madam as multi-purpose worker female. Now it is not an health assistant because health assistant can also conduct the delivery, but she is not posted at the sub-center. That is only the catch, that health assistant is posted at primary health center. Same like a medical officer is also posted at the primary health center, and Asha is not conducting the delivery. So like that we have to come to the correct answer. Now another is that in the middle of night, a pregnant woman starts labor pain. which health worker is called by the relatives to go to the hospital, and this is none other than the ASHA worker. We know that ASHA is a part of a very important national program, that is National Health Mission, and she is responsible for a very important activity as Janani Suraksha Yojana, and under that she is taking the patients who is in labor to the nearest hospital or nearest center, could be the sub-center, could be the primary health center, and the reason for this is that she is motivating the community to go to the hospital to have institutional deliveries to decrease the MMR. So she is going along with the patients, along with the relatives, and she is getting the incentive for that, and this activity is the Janani Suraksha Yojana, and this is in term is to reduce the maternal mortality ratio. So the worker who is going along with the patient for the delivery to the institution is ASHA worker. Now the lowest center where the primary gravida with the placenta previa should deliver. Okay. Now here there is a overlap of this question to the obstetrics. Now here we should be knowing that what is the mode of delivery if a patient is having placenta previa. Now we know that placenta previa patients might be requiring the cesarean, they can bleed, they might be requiring the blood transfusion, and these two facilities, they are available from the lowest center, community health center onwards. This is in our mind. So now we have to see the choices. She can deliver at CSC and district hospital. Yes, this could be the answer. She can deliver at PSC and district hospital. No, because in the PSC we cannot do the cesarean. So this is not the answer. PSC, no, again she cannot deliver. CSC and PSC, again it is not the PSC. So here the correct answer is, it is the A, that is community health center and district hospitals. Now coming to another very important section which is asked is what test of significance we will be using while comparing the data. So quickly we will revise that what are the various tests what we can use depending upon whether this is quantitative data or qualitative data. So parametric test we are using for the quantitative data. For the quantitative data, and non-parametric test we are using for the qualitative data. Now how we can identify? Now if the mean value or the standard deviation is given, it is a quantitative data, and if the percentage or the proportion is given, it is your qualitative data. Okay. Now if we are comparing the two groups, then we are using the student t-test if we are comparing the two groups. Now if these two groups are paired, means we are comparing the same group before and after intervention, we are using the paired t-test. But if these two groups are different, then we are using the unpaired t-test. And if you are comparing the more than two quantitative groups, then we are using the ANOVA test. Where we are using the sign test, if you are comparing the two paired qualitative data, we are using the sign test, and if you are comparing the two or more unpaired, then we are using the chi-square test. So keeping this information in the mind, now coming back to the questions that are very commonly asked in the examination is like this. Now try to identify what test we will be using. To test a new anti-diabetic drug, initial blood sugar of 50 patients were checked. So what they had done? They had checked the initial blood sugar of the 50 patients. So blood sugar, it is the quantitative data. So they are talking about the parametric test, one thing. So they had made a one group where they had checked the blood sugar of the 50 patients. Then they were given the new drug, and after the 1 month again their blood sugar was checked. So it is the same individual, after the 1 month of the therapy, again the sugar is checked. So we are comparing the two groups, quantitative, so we are using the student t-test. This is one thing. Second is, it is the paired groups, then we are using the paired t-test. You all are answering very correct. We are using the paired t-test. Now coming to the another question. In a study, the patients were selected in the two groups of 100 each of the different variety of the jaundice. So we are having the two groups of the different variety of the jaundice. Now their serum bilirubin was measured. So this is again a quantitative variable. We can measure the serum bilirubin. So we are talking about the parametric test, one thing. So they had taken the two groups. Now what they had done, serum bilirubin was measured before and after the 3 months of the therapy. So they had made a two groups, A and B. So they had measured the serum bilirubin initially before the therapy, and again after 3 months of the therapy, they had measured the serum bilirubin again. Now what they are doing, which test is used for analysis of these two groups after the 3 months of the therapy? They are not asking before, or they are not comparing after to the before. What they are saying, that after the 3 months, if you are having this serum bilirubin of the one group and this is the serum bilirubin of another group, so we are comparing these two different groups. So we are using the unpaired t-test. So all are answering very correct. It is your unpaired t-test. Now another is to compare the construction material used in the urban and the rural area. The study conducted, and it was reported that use of wood, marble and the brick was 40%, 30% and 10% respectively. 30-60% test used for analysis. Now here they are comparing the urban and the rural areas, two areas, and the construction material we are using of a different variety, that is wood, marble, brick, and their proportion is different. So they are giving us the a proportion. So it is your qualitative variable. They are comparing the two different individual groups in the urban and the rural area. So we are using the chi-square test. You all are answering very right. Okay. So I'm very happy that you all are clear with the concept and you are answering very correct. And these type of the questions are very commonly asked in examination. Now coming to another very important area where they ask the question is that how much is the percentage of the population being covered in the plus minus of the 1 standard, 2 standard and 3 standard deviations. So before going to these questions, just try to summarize the Gaussian curve, and this is your bilaterally symmetrical bell-shaped. And if the values are symmetrically distributed, then 68%, I'll go in a round figure, 68% value will be covered within the plus minus of the 1 standard deviation. Okay, 95% values will be covered within a plus minus of the 2 standard deviation, and the 99% values will be covered within a plus minus of the 3 standard deviation. Okay, now please read the question carefully. Little bit a higher level question if they are asking outside, and mainly they are asking outside of this plus minus of the 1 standard deviation. Now if they ask within the plus minus of the 1 standard deviation, we are having the 68%. If they are asking how much is the outside, if they are asking total outside is the 32%. Now if they are asking on the upper side, it is only the 16%, and again on the lower side it is the 16%. So read the question very carefully. Commonly they ask within, but make a question little bit of a higher level, they can ask on a outer side also. If they are asking on both the sides, total it is a 32%. If they are asking on the one side, means beyond the plus 1 standard deviation, or it is below the minus 1, it is only the 16%. So keeping this in mind, then coming to the question. Now in a group of 20 children with a mean weight of 40 kilogram with a standard deviation of 2 kilogram, which statement is correct? So dear friends, I'll give you a trick how to solve these questions. Now if you know that the mean weight is given, you know how much is the standard deviation. So first try to calculate in your mind what is the range of the values between a plus minus of the 1, 2 or 3 standard deviation. So we know that plus minus of a 1 standard deviation, if it is -2 less, +2 more, so within a plus minus of the 1 standard deviation, the weight range will be 38 to 42 kilogram. This I know. Okay. Now within a plus minus of the 2 standard deviation means -4 less and +4 more. It means your range means 36 to 44 kilogram will be within a plus minus of the 2 standard deviation. Okay. And if I say that within the plus minus of the 3 standard deviation, 6 kilogram less, 6 kilogram more, that is between 34 to 46 kilogram will be within the plus minus of the 3 standard deviation. So this thought should be coming in your mind parallel. The second thought is that how much is the percentage of the values are being covered in this. We know that within a plus minus of the 1 standard deviation, it is covering the 68%. Within the plus minus of the 2 standard deviation, it is covering 95%. Within the plus minus of the 3 standard deviation, it is covering the 99%. So this should be in your mind. Now you have these values, these statements in your mind, then see the choices. Again, now if you are having the difficulty in remembering all the 3 at a time, now we'll read the choices one by one. Might be taking a time more than a 1 minute, but yes, we'll try to solve. Now 98% of the children are between 38 to 42 kilogram. Now 38 to 42, if I calculate, it is coming within the plus minus of the 1 standard deviation, and I know how much is the population being covered here is 68, so it is a wrong statement. 95% children are between the 36 to 44 kilogram. Now I know this is a plus minus of the 2 standard deviation, it is covering the 95%, and I'm very happy that most of you are answering very right that this is the correct answer. 99% children are between 38 to 42. No, this is a range of plus minus of the 1 standard deviation. So again, this is out. 99% children are between 36 to 44. Again, this is a range of plus minus of the 2 standard deviation. This is out. So here the correct answer is B. So you can go in any of the way. Clear? This type of the questions are asked. So be very careful. So if you know the concept, just give a few more seconds. We'll come to the correct answer. Don't be in hurry. Now another question is, in a group of the 50 children with a mean hemoglobin of the 12 gram percent. So here the one keyword is that mean hemoglobin is 12 gram percent with a standard deviation of the 1 gram percent. Calculate the number of the children with the hemoglobin of 11 to 13 gram percent. So they had given us a range of the hemoglobin, that is 11 to 13 gram percent. And we know that this range is how much? 1 gram is the standard deviation, mean is the 12 gram. So this range is within the plus minus of the 1 standard deviation. Now here we don't require any rocket science, any formula for calculation. They had only given us the percentage value, and we know that how much is the value being covered within a plus minus of the 1 standard deviation. It is 68%. You are answering again very correct, because it is the 68%. It is within the plus minus of 1 standard deviation. They are not asking outside. If they are outside, it will be 32%. 95% will be the plus minus of the 2 standard deviation. 99 will be in the plus minus of 3 standard deviation. Clear? So remember that these type of the questions are asked in the examination. Now coming to another very important section where they ask various vectors of the diseases. So quickly we'll see the images, because it could be the image based question also. Now this is your housefly, and we know housefly is transferring the infection, and it is mainly leading to the intestinal infections. This is the louse, mainly causing the epidemic typhus, tinge fever, relapsing fever, and we are remembered with the mnemonic as ETR. We are having MTR masalas. So it is an ETR, epidemic typhus, tinge fever, relapsing fever, and pediculosis. This is the flea causing the endemic typhus. This is the mite, and it is causing the scrap typhus and rickettsial pox. So 3 different type of the typhus by the 3 different type of vectors. Then we are having the mosquitoes. Again, they are very, very important, and they are being asked in the examination. So we have to identify the mosquito, and then we have to answer. So if this mosquito is making an angle to the surface, it is your Anopheles mosquito, which is causing malaria. Now if mosquito is sitting parallel to the surface but without the white spots on the body, it is your Culex mosquito, and mainly it is causing filariasis and Japanese encephalitis. Now, if the mosquito is sitting parallel to the surface with the white tiger-like spots, is the Aedes mosquito, and this is causing the dengue, chikungunya, Zika virus disease or yellow fever, and this is Mansonian mosquito, hardly being asked in the examination. Then we are having another very important vector, that is the scent fly, phlebotomous fly, very commonly asked in examination, and this is causing the disease which we can remember as a COSO, is Kala Azar, oriental sore, then scent fly fever and Uriah fever. This is your redwood bug causing the Chaga disease, and this is the tick, and very importantly they ask is the KFD. In India, KFD is caused by the hard tick. Outside India, it is caused by the soft tick. So these are the very, very important image based questions. They can ask what this vector is or what the disease is being caused. So with this knowledge, coming to quickly the questions, that vector of leishmaniasis. So leishmaniasis vector, it is none other than, we know that leishmaniasis is the Kala Azar, and it is being transmitted by scent fly, and you all are answering very right that it is being transmitted by scent fly. Now KFD in India, as we had already discussed, that outside India it is caused by a soft tick, but in India it is caused by hard tick. Okay, and filariasis. Now this is another question, that filariasis is mainly caused by Culex, but again you are not going to stop here, that in some areas it is also caused by Anopheles and the Aedes. So it is, the best answer here is all. But suppose if a question is asked that filariasis is mainly caused by which vector, then your answer should be the Culex. Okay, so read the question very carefully. Now coming to another disease area and treatment of malaria, very, very commonly asked in the examination, that malaria treatment. Now if we come to the just summary of a malaria treatment, that what it is. Malaria is caused either by the Vivax infection or it is by the falciparum. Now the drug of choice is different for both as per our national program, that is National Vector-Borne Disease Control Program. And another very important point is that in the pregnancy, the treatment is different. So while reading the question, you should be looking for what is the species, whether it's a Vivax malaria, it is a falciparum malaria. Second is, if it is a falciparum, then it is in the northeast states or other states. And the third is whether the person is pregnant or not. Okay, so if a patient is having a Vivax infection, then chloroquine is the drug of choice. It is the drug of choice. And the primaquine we are giving in the dose of 0.25 milligram per kg of the body weight to be given for 14 days. But if it is a falciparum infection in the northeast states, we are giving the ACT-L combination, and in the other states we are giving the ACT-SP combination. And we have to remember here the dose of primaquine. The primaquine in both the conditions we are giving a 0.75 milligram per kg of the body weight as the single dose. Okay, but in the pregnancy the protocol is little bit changed. Now in the Plasmodium vivax, the chloroquine is the drug of choice, but primaquine is contraindicated. And in the falciparum infection, the first trimester, the drug of choice is only the quinine. Quinine is the drug of choice, while in the second and the third trimester, depending upon the area, if it is in the northeast states, then the treatment protocol is ACT-L combination, and if it is in the other states, the treatment protocol is ACT-SP combination. But remember, the primaquine is contraindicated. Okay, so keeping this information in the mind, now try to solve the questions. So be very careful. As I said, that look for the three situations, look for the three situations that what is the species, where they are living, and whether they are pregnant or not. So the correct statement is chloroquine is the drug of choice for falciparum malaria. No, because for the falciparum malaria, the chloroquine is not a drug of choice. It is the artemether combination. Artesunate therapy is given for falciparum malaria in the first trimester of the pregnancy. Again, not, because in the first trimester of pregnancy, the quinine is the drug of choice in falciparum. Dose of primaquine in the falciparum malaria is 0.75 milligram per kg once. Yes, this is the correct answer. Dose of primaquine in the Vivex malaria is 0.75 milligram per kg for 14 days. No, we are giving only for Vivex malaria is 0.25 milligram, but it is not 0.75. 0.75 we are giving in the falciparum. So again, this is a correct answer. So sorry, wrong answer. The correct answer is the dose of primaquine in the falciparum is 0.75 milligram per kg once. Okay. So here the choices are appearing little bit big, but we have to see each and every option and try to identify the correct answer. Now coming to the next set of a question. A person living in the Mumbai reported as positive for falciparum malaria. Now here the two keywords are there. The first is that person is living in the Mumbai, that is other than the northeast states, and second is diagnosed for malaria by falciparum infection. So the correct statement of the drug of choice, we know for the falciparum, chloroquine is not a drug of choice. Now, if it is a northeast states, then it is a artemethyl It is again out. It is in the Mumbai. So it is a artesunate, sulfadoxine, and pyrimethamine. You all are answering correct. It is the C is the correct answer. Now again, why I had tried to give you the multiple questions. So it is not only the 25 questions we are discussing, might be more than 100 questions, but I am trying to give you the concept and how the different type of the questions are asked. So you are not going to be confused if a googly ball is being thrown on you on the day of examination. So you should be able to solve that question also. Okay. Drug of choice for treatment of Plasmodium falciparum infection in a lady who is having the 8 weeks pregnancy. So here again the catchword is that she is pregnant and pregnancy is 8 weeks. And what type of malaria she is having? She is having the falciparum malaria. And we know that falciparum in the first trimester, what is the drug of choice? The drug of choice is none other than the quinine. If they say that it is the Vivex malaria 8 weeks, your answer should be the chloroquine. If they say it is the 20 weeks pregnancy with the falciparum infection, then depending upon the area, it can be the artemether or artesunate. Okay, but here it is the 8 weeks first trimester, so none other than the quinine. So in this way, you have to solve the questions. Very commonly they ask in the examination. Now coming to the another set of questions, very commonly they ask is the vaccination schedule of rabies. Okay, here you should be knowing the pre-exposure schedule, the post-exposure schedule in the vaccinated and non-vaccinated individuals. Okay, so coming to the question that pre-exposure rabies vaccination schedule. Now we know pre-exposure means before the dog bite. It is usually being taken by the veterinary doctors or by our forest officers. So pre-exposure rabies vaccination schedule, we know it is a 0728. So we should be knowing the answer and we have to find that answer. 0728 is the correct answer. Now 0371428, it is the post-exposure in the non-vaccinated individuals. It is your intramuscular SN regime. Now 03, it is again the post-exposure intramuscular in the already vaccinated individuals. And 0371428 was in non-vaccinated individuals. Now 22202, it is again the post-exposure intradermal schedule in the non-vaccinated individuals. Okay. Now one more a question is, if they ask which is better in the post-exposure or the intramuscular and intradermal, then your answer should be the intradermal. Now, schedule for the post-exposure rabies prophylaxis, it is the, again, it's a twisting of the question, but the concept is same. 03, yes, it is in the already vaccinated individuals. 037, 14, 28, again in the non-vaccinated individuals, intramuscular. 22202, it is the intradermal in non-vaccinated individuals. So, here the correct answer is the D, that is all is the post-exposure rabies prophylaxis schedule. Clear? Now, some of you are answering only B. There, they didn't mention it is either the vaccinated or non-vaccinated. So, we have to see the choices very carefully. So, the correct answer is the D. It is not the B. Okay. This is what the small mistakes we make. And mind my words, if you can avoid these small silly mistakes, you are going to get the 10 to 15 extra marks in your upcoming examination, and believe me that these 10 to 15 marks will be grace marks to you, and that will be very helpful in having a total tally of the marks at the time of the result. Okay, so why to lose even a single mark when you know the concept? Okay, now coming to the next question, it is related to the same concept of the rabies vaccination. The 10 weeks pregnant woman brought to the clinic with a grade 2 dog bite 4 hours before. Now, how the doctor will proceed? Okay, so here quickly we'll revise what are the grades of the dog bite. The grade 1 is lick on the intact skin and nothing has to be done. The grade 2 means the nibbling or the scratching. Just there is a nibbling and scratching. Khoon nahi aaya hai. Khali nibbling and scratching is there. And the grade 3 is if there's a multiple wounds, or there's any wound with the blood, or there is a lick or the spillage of the saliva on the mucous membrane. It's a grade 3 bite. So, in the grade 1 nothing is required, and in the grade only we have to give the reassurance. The grade 2 we are giving the vaccine, and in the grade 3 bite along with the vaccine we are also giving the immunoglobulins. Now, here the concept is that grade 2 bite is there, you have to give the vaccine, but only the catch is that examiner has put you the trick that the lady is pregnant to confuse you with whether you can give the rabies in the pregnancy or not. Now, always remember that rabies is a killed vaccine, so it is very safe in the pregnancy. Now, even anything what we are giving as a life saving is more important than saving the pregnancy. First, we have to save the life of that woman, then we will think about the pregnancy. Okay, so this is only that a 10 weeks pregnancy word the examiner has given to confuse you. So, no treatment can be given as she is pregnant. That's why they had kept this as a first choice, that no treatment can be given. No, in the pregnancy we can give the rabies. So, this is a wrong answer. The first do an MTP, then give the rabies vaccine. What a nonsense. No, we are not going to do the MTP. Only the wound dressing. No, it is a grade 2. So, we are requiring the full rabies vaccination schedule and continue the pregnancy. I am very happy that you all are answering quite correct. So, this is about the rabies vaccination or immunization. The two more points has been asked from the rabies. One is that what is the amount of the immunoglobulin we are giving. If we are using the human immunoglobulin, it is 20 international units per kg of the body weight, and if you are using the animal immunoglobulin, it is the 40 international units per kg. And the second question what they ask is, which is the best test for diagnosis or the confirmation of the rabies, is demonstration of the Nagra bodies in a post-mortem specimen in the brain biopsy, and the most important site is M1 horn of hippocampus, and second site is cerebellum. So, remember these points also. Then coming to the another area, and that is the I think the last question of the this session, that from the vitamin A, and vitamin A is also a very, very important area, very commonly asked in examination. So if we go with the question that while doing the survey in the school children for vitamin A deficiency, the most important sign. Now, if they are asking that most important sign while doing the screening or the survey in the school children, that we are using the white dot spots. Now, here if they ask what is the first sign, then you should go with the conjunctival dryness. If they ask what is the first symptom, you should go with the night blindness, but they are asking that in the screening of vitamin A deficiency in school children, the preferred parameter is the white dot spots. Now, doses of the vitamin A for treatment of vitamin A deficiency in the children more than 1 year. So, if we are going for the treatment we are using the 3 doses, and very frequently that like a 0, 1 and 2 to 4 weeks, means today, then tomorrow, then after 2 to 4 weeks. And the concept is same. If the age is less than 1 year, we are using a 1 lakh international units per dose. More than 1 year, we are using the 2 lakh international units. So 1 lakh is out. Then 2 lakh single dose, no. For the treatment, we are not using the single dose. So the correct answer, you all are answering correct. It is the 2 lakh international units, 3 doses. So, dear who are answering as a single dose, we are not going for prophylaxis. We are going for the treatment of the vitamin A deficiency. So, we are using the 3 doses. Clear? And one question asked in the last exam was related to the weight. So, if a baby is more than 1 year, but still if the weight is less than 8 kgs, then we are using the 1 lakh international units only. And if the weight is more than 8 kgs, then definitely we are using the 2 lakh international units. Now, coming to another point is, a health worker is doing the survey in the community for vitamin A deficiency, the most sensitive indicator. So, most sensitive indicator of the vitamin A deficiency is the serum retinol level if it is less than 10 milligram %. And when we can say it's a major public health problem, when the night blindness prevalence, if it is more than 1%, Bitot spot prevalence, if it is more than 0.5%, the serum retinol less than 10, just correct it, it is a microgram, less than 10 microgram % in more than 5% of the population, and the corneal ulcer, or we can say the corneal scar, if it is in more than 0.05% population, we can say it is a major public health problem. So, these are the important points what has been asked related to vitamin A deficiency, and the very important national program we are having is vitamin A prophylaxis program. So, these were a few important clinical questions, and we had tried to discuss the concept left and right, up and down, so you can answer all the questions without having any mistake or a doubt in that. So, overall, if we try to summarize that how many questions are being asked from the different topics, because it's a very, very commonly asked question by all of you, that which topics are important, which topics we have to focus. Now, friends, exactly I cannot say that these are the numbers being asked from those topics, but from our experience in the past exams, what we had seen, that the chapters or the topics which are having the more weightage, and some topics are having the less weightage. Now, overall, as per the national board, the 30 questions are supposed to be asked from the community medicine, but we had seen that around 35 to 40 questions are asked, and around 5 to 6 questions could be an overlap between the PSM, obstetrics, PSM, pediatrics. So, roughly around 33 to 35 questions are directly straightforward being asked from the PSM. So, it is supposed to be a very, very important game changer in your examination. If you are having a good hold over this subject, good control over this subject and its concept, then you are going to get almost a full marks in this subject from the questions. Okay. Now, what we had seen that around 7 to 8 or 7 to 10, I'll say, the questions are asked from the diseases. Now, here I am including all the infectious, non-infectious, non-communicable, communicable diseases and their related national programs. Clear? Now, prevention in the obstetrics and pediatrics is again a very important topic, and around 3 to 4 questions are asked from this topic. Nutrition is again very important, and around 3 to 4 questions are asked from this topic. Now, health education, one question is asked. Occupational health, one question is commonly asked. Contraception is again, if I include the demography and contraception, around the 4 questions, and if I say separately the contraception, around the 2 questions. Epidemiology is around roughly the 2 questions. Demography, again around roughly the 2 questions. Vaccine is again around 1 to 2 questions are asked. Healthcare system is again 1 to 2 questions are asked. Means an ASHA workers, Anganwadi workers and multi-purpose workers. These are the 3 important workers. Prevention levels, 1 question is asked. Statistics, around 2 questions are asked. Concept of health and disease, the 1 question is asked. Environment is again the 3 to 4 questions are asked, especially the insects, chlorination, air quality. Biomedical waste, 1 question. Social health, 1 question. International health, 1 question. Screening, 1 question. Health planning and management is again the 1 question. Disaster management, 1 question. And miscellaneous, I am leaving as 3 to 5. So, this is what we had tried to find out by analyzing the past year question papers. This may not be exactly the distribution, okay. So, don't think this is an exact distribution, but this is nearby distribution, or probably the topic-wise distribution is like this. So, you can say that major topics are like a nutrition, prevention in the obstetrics and pediatrics, then demography and contraception, environment. So, these are the important areas, and obviously the important diseases, especially the infectious or the non-infectious, for which we are having the national programs, because it means they are in a more severity, we are having the problems with that. So, you have to study those diseases very carefully, for which we are having the national programs, okay. So, in the last I can say that accept your past without the regret. Whatever the mistakes you had made in the past, just forget this, but try to learn the lesson, keep the lesson with you. Now, handle your present with the confidence. You are studying very hard, you should have your self-confidence, and we have to face your future without fear. So, once you are appearing in your exam without the fear, definitely you are going to give your maximum output, okay. And what I can say, that do your best and forget the rest. Just leave everything on the God. Only you have to focus what you can do best right now. What you can do in the last coming 3 days for the Neet PG aspirants. What you can do in the last 17 days for the FMGE aspirants. Do your best and don't think about the outcome. Once you start thinking about the result, you may be disturbed. Just do your best, leave everything on the God, okay? Because once you had decided or you had dreamed to clear your exam, definitely you can do it and you will come out with the flying colors. So, with these words, what I can say that thank you very much for your patient hearing, and from my bottom of my heart, I wish all of you should pass in your examination. All of you should get the highest possible score in the upcoming examination. All of you should get the desired seat, especially for the Neet PG aspirants in the upcoming examination. And we are always with you. You all are having my contact number. So, anytime if you are having any problem, you are most welcome to ask. Okay, we are always with you. We are 24/7 with you. So, my dear friends, God bless you. All the very best.